Good morning, everyone. I would like to call this meeting to order. At this time, I would like to acknowledge that we meet on the traditional land of Treaty 6 territory and acknowledge the diverse indigenous peoples whose ancestors' footsteps have marked this territory for centuries, such as Cree, Dene, Sotu, Blackfoot, and Kotasu, as well as Métis and Inuit, and now settlers from around the world. And I will do a quick roll call. Councillor Wright.
Good morning, I'm here.
Councillor Knack.
Good morning.
Councillor Principe.
Good morning.
Councillor Stevenson.
Good morning.
Councillor Paquette. Councillor Tang.
Good morning.
Councillor Hamilton.
Good morning.
Councillor Rutherford. Councillor Salvador.
Good morning.
Councillor Cartmel.
Good morning.
Councillor Rice.
Good morning.
Councillor Jans.
Good morning.
And I'll check again Councillor Rutherford
Good morning.
and Councillor Paquette.
Good morning.
Good. So everyone is here. And this meeting is the continuation from our Monday's meeting. And we have a number of items to deal with. Agenda has been approved, protocol items are done, everything else is done. We can get into our agenda quickly, but we do have some housekeeping stuff that we could actually deal with quickly on bylaws before going to the COVID update. And Councillor
Yes,
Stevenson?
Yes, that's right, Mr. Mayor. Thank you. I just want to move that we bring items 7.4, 7.7, 7.8, and 7.9 forward for voting.
Okay, that is moved and seconded by?
Second.
Second by Councillor Knack.
So just for clarity, can we just confirm that Councillor Rice selected those three bylaws for voting purposes only?
Yeah, because these are, so Councillor Rice, you selected those, the item 7.7, which is only for voting purposes because we can't have a debate on that. And then 7.8 and 7.9 for voting purposes as well, right?
Yes, I think that this move forward, and then we didn't get opportunity to speak on 7.7 and also 7.8, 7.9. And so my question is that okay? We can just select 7.8, 7.9 for voting purpose, and for 7.7, I think we have somebody request to speak.
Yeah,
And-
so from a process point of view, Councillor Rice, I agree with you. You can bring forward 7 and 8, 7.8, 7.9 for voting purposes. I appreciate that. So thank you for that. As far as 7.7 is concerned, because
7.7, and is there opportunity for 7.7 for just the speak?
no, the process would not allow that because third reading was not granted. This bylaw is here only for voting purposes only for third reading. So nobody can speak to it and nobody can make a presentation to it.
And then nobody can speak to this voting.
No, not at all.
As well.
No,
Okay, so include council member.
no.
Okay.
Okay, all right, good.
If that is the process, and then I will follow it.
Okay, thank you so much for that. Okay, so please vote to bring those bylaws forward.
We have all the votes.
Display the votes, please. That is carried.
Mayor Sohi, I'll move first reading of bylaw 19981.
Thank you, Councillor Cartmel.
Second.
Second by Councillor Stevenson. Please vote on the first reading of bylaw.
We have all the votes.
Display the votes, please. That is carried.
Mayor Sohi, I will move third and final reading of Charter Bylaw 19929, Bylaw 19900, and Charter Bylaw 19901.
Point of order.
Just hold on, Councillor Rice. We need a seconder, please.
Second, Councillor Tang.
Councillor Tang seconded it. So, Councillor Rice, you have a point of order. What is it?
Yes, and for 7.7, 7.8, 7. I understand 7.8 and 7.9 we have to deal with together, and then but for 7.7 that's separate item. Can we vote separately?
Absolutely, we can do that. So we have to kind of withdraw that, Madam Clerk, right? So, Councillor Cartmel, you okay, and Councillor Tang, you okay withdrawing that?
Yeah, I'll withdraw my motion, Mayor Sohi.
Okay, Councillor Tang, thank you so much. Can you move them separately, Councillor Cartmel?
I can. I will move third and final reading of Charter Bylaw 19929.
Second.
Second by Councillor Tang. Please vote.
We have all the votes.
Display the votes, please. That is carried.
Mayor Sohi, I'll move third and final reading of Bylaw 19900 and Charter Bylaw 19901.
Second.
Second by Councillor Tang. Please vote.
We have all the votes.
Display the votes, please. That is carried. Thank you, council members, for accommodating this. Appreciate it. Okay, now we are into, which item are we on to, Madam Clerk?
Which item would you like to start with today?
Oh, I think we are going to get into the item on COVID update,
Perfect. Thank you.
which is
Item 6.9.
6.9. Here you go. COVID verbal report from city administration. So over to our city manager.
Thank you. Good morning, Mayor and Councillors. Our COVID-19 journey has been full of stops, pauses, and starts. Today's update is focused on the province's newly announced easing of public health restrictions and invites discussion of how the changes could impact Edmontonians. The province's relaxation plan readies Albertans for a shift in the way COVID-19 is managed. As the province explains, the relaxation of restrictions is a step to learning to live with COVID. Administration's response to the plan is to approach it with the same caution and strategic direction that has guided us for the past 2 years. Joining me virtually this morning are members of ELT, Nicole Poirier and Michelle Plouffe, the Chair and Vice Chair of COVID-19 Task Team, and of course our guest, Dr. Chris Sikora, the Edmonton's own Medical Officer of Health with Alberta Health Services. Today's presentation is for information and discussion, and we are prepared to work with all of you throughout the discussion to draft possible motions based on what we hear through your conversations and questions, and we stand ready to implement any decisions you make as a result of these discussions. Since the onset of the pandemic in early 2020, administration has aligned its COVID-19 response efforts with guidance of the provincial health authorities. They have been a trusted source of scientific and medical information and expertise. And as we navigate the plan for easing provincial restrictions at Edmonton, we consider a number of factors, including evidence-based data and the city's hands-on experience. We are aware that there are divergent opinions about the speed and scope of the relaxation plan and different levels of perceived and real comfort about the removal of restrictions. Finding the right balance is challenging, but we have our guiding principles to provide direction. Our presentation today contains information updates, but more importantly, we are interested in Council's views on other discussion points. These guiding principles have helped us to frame and make our decisions since the start of the pandemic. Get the next slide, please. They have been adjusted along the way and tested each time we responded to a new wave of infections. These principles ensure that we make consistent, strategic, and evidence-based recommendations to help protect the safety of Edmontonians. And now that the province has shifted its approach to manage COVID-19 for the long term, our principles still remain highly relevant. They include following the advice and guidance of Chief Medical Officer of Health for Alberta and guiding whether it is safe to relaunch facilities, services, and programs. We consider city resources that will be taken into consideration as we relaunch. GBA Plus is very important to ensure inclusion and equity throughout the pandemic. Vibrancy and safety of things like our downtown and other pieces of the local economy. And the citizen-informed city plan will help us guide choices we make to be a healthy, urban, climate-resilient city that supports a prosperous region. Reopening must consider their strategic goals, guidelines, and outcome intentions and directions as described in our city plan. Now this slide, as you've seen previously, shows the transmission of the Omicron variant in the Edmonton zone since the end of December. As a reminder, the Edmonton zone includes the city of Edmonton, along with regional partners like St. Albert, Morinville, Parkland County, Strathcona County, and Leduc. And Dr. Sikora is the Chief Medical Officer of Health for the entire Edmonton zone. As I explained in our January update, the most frequently used indicators to describe the Edmonton zone COVID status have changed with the arrival of Omicron. The number of active cases and the active case rate per 100,000 are interesting, but less useful than the positivity rate and wastewater analysis. COVID restrictions were put in place to protect the healthcare system, so hospitalizations and ICU admissions continue to be watched closely. This chart shows that there is still significant strain on that system. The city's COVID-19 dashboard on edmonton.ca brings together Alberta Health Services Edmonton zone data from across multiple sites in a one-stop reference source. Yesterday afternoon, the province announced its three-step plan for easing of COVID restrictions. Step 1 started today and includes the repeal of the REP program. Capacity limits have not changed for venues greater than 500, but restrictions for the sale of food and beverages and consumption while seated and during intermission in large facilities and entertainment venues have been removed. Capacity limits for locations and venues not covered by the REP program, including places of worship, retail, and malls, have been removed. Effective February 14th, masking requirements for children 12 and under and children and youth in schools will be removed. Face coverings for those over 12 remain mandatory. There is no change at this time to outdoor events and facilities, and there are no capacity limits but must maintain 2-meter distancing between households. If hospitalization trends continue to decline throughout February, Step 2 could begin on March 1st. And the highlights in the announcement from the province include indoor masking requirements could be lifted, no capacity limits for all large facilities and entertainment venues, a resumption of interactive activities in restaurants and bars, regular liquor service could resume, screening prior to youth activities will no longer be required, limits on social gatherings will be removed, and the mandatory work from home requirement could also be lifted. A timeline for Alberta entering Step 3 is not yet determined and will depend on hospitalization rates continuing to trend downwards. Highlights include the elimination of outbreak protocols in continuing care facilities, and there will no longer be a requirement to isolate, rather it will become a recommendation. I will now ask Dr. Sikora to provide us with some insights from Alberta Health Services. Dr. Sikora.
Thank you very much, Mr. Kobold. So overall, we are in the downslope of this Omicron, the fifth wave of COVID-19. So while stressed, our hospitals have managed to continue to deliver service. Across our society, a lot has changed in the past year. It's much more commonplace to check your symptoms and stay home when you're sick. Getting vaccinated is something that we can do at all ages. Use of a mask is something as an important tool to protect ourselves and others around us is much more common. And there's been an advent of new treatments available for COVID-19. So we will have to learn to live with COVID. So it will continue with us for much longer into the upcoming months to possibly years. So this shift in endemic is something that all provinces and countries are working towards and working through. So as with the new changes from the government of Alberta, it is a stepwise approach. So the elimination of the REP is outlined by the province. The REP was intended to limit transmission and to increase immunization. So removal should have limited impact to transmission, but there will have to be really a careful monitoring of what hospitalizations look like. There is a lot that we still can do to protect one another as individuals, as family, as workplaces, as well as communities. And it's important to have these principles really at heart. Get vaccinated. It's safe, it's effective, it works. and follow those recommendations to get your third or reinforcing doses once those recommendations are made by our provincial partners. Stay home if you're sick. Check your symptoms daily. So undertake that safe for work, safe for play, safe for learning, as it's something that's important that protects and keeps you safe and healthy, but also keeps those safe and healthy in your workplace, your learning environment, or other settings. Wear a mask. Wear a mask to protect you and others around you. Follow up with your family physician if you're feeling unwell or feeling stressed. Wash your hands and check your symptoms. Mr. Copeland?
Thank you, Dr. Sikora. One of the principles guiding our COVID decisions is a commitment to protect and promote the local economy. We've asked our business improvement area partners to provide feedback on the relaxation of the restrictions. And it's important to note that we were not able to complete a fulsome engagement, and there was not consensus on each item. But the overarching theme seemed to be, if we're not going to follow the province's lead, that we need consistency and unity on remaining mandates in the capital region. Businesses have very little appetite left to enforce restrictions, and if the city has different restrictions than the province, consistent enforcement could be unlikely. We also checked in with our regional administrative colleagues. Many have not yet gone to their respective councils for advice and guidance. However, we understand that most will be recommending that their municipalities follow the province's lead. Lots of those discussions are happening today and tomorrow, so we have yet to see what the council decisions from our regional partners are. The City of Calgary's administration is meeting with their Community Development Committee this morning. Their COVID-19 vaccine passport bylaw lapsed automatically with the cancellation of the restriction exemption program by the province. Their bylaw required many businesses and organizations to confirm proof of vaccination, a recent negative COVID-19 test, or valid medical exemption letter for entry of customers. Administration's response recognizes this is not the end of COVID. The province's plan signals a shift in the approach to managing COVID over the long term, where the virus continues to be present but is manageable. To get there, Edmontonians will need to continue to exercise good judgment and be kind and compassionate with each other. Due to the province's announcement on the removal of the restriction exemption program, we have initiated an immediate response. We are requiring active screening first thing this morning for symptoms at entrances to city facilities, and we'll be asking people to stay home if they are sick. And early reports from our facilities are that this transition has gone very well this morning with clients that are visiting our facilities. This is the best way to keep our facilities safe for patrons and employees. This allows us to lead by example, as the isolation order for people with symptoms or testing positive is still in place, and we need people to stay home if they are sick. The announced changes to masking will create difference in the provincial mask mandate and the city's face covering bylaw. The city face coverings bylaw, which is in effect, will require amendments to align with provincial changes, or it will stay in place and go above and beyond the provincial regulations, which is possible. We will go into more detail on the following slides with options on potential measures that can be put in place. So the following slides are options for Council's consideration. First, the restriction exemption program was fundamentally a proof of vaccination requirement to gain entry into places of business. The province has explained that the program was successful in achieving its goal of increasing immunization rates, but vaccination rates have plateaued at the current level since December, and it is unlikely that REP will influence further vaccination. The city's response to the removal of the REP program can include enacting regulations that mirror the previous restriction exemption program at city-owned and operated locations and/or with private businesses. Our options include ending participation in the restriction exemption program effective February 9th, maintaining active screening for COVID-19 symptoms in city facilities, maintaining vaccine negative test requirement for city-owned and operated facilities, and maintaining vaccine negative test requirements for all REP eligible businesses in Edmonton, which is a step beyond what we've done before. As of this morning, city recreation centres have implemented active system screening for all individuals at facility entry points, and this aligns again with the public health principles and is a recognized mitigation strategy for reducing transmission and keeping our staff and patrons safe. Implementing a program above active system screening similar to the restriction exemption program does have a number of challenges. What we heard from BIAs is a desire for the city to align and have consistency across the region. Setting a regulation that exceeds the health authority can be difficult to justify, and we lack the medical expertise and scientific evidence of epidemiologists. Without an order from the health authority, it may be difficult to obtain agreement from patrons and access their personal health information. And we do not know how long we will be able to use the provincial app for confirming vaccinations using the QR code. It is working as of this morning. If it stops working, the only option we would have is to review paper copies or copies of proof of vaccination on mobile devices. And if the city were to implement REP, the burden of administering and enforcing would rest with frontline workers, staff, and servers. This could lead to unwanted confrontations directly with low-wage earners who have limited or no enforcement training. And so this very much, I think, needs to be a GBA plus consideration as we have this discussion. Currently, the city's temporary mandatory face covering bylaw requires anyone over the age of 2 to wear a face covering in public places. There are two main options to consider in light of the provincial announcement yesterday. Council could choose to maintain the current city bylaw and require face coverings for those Edmontonians aged 2 or older, or the city can align with the provincial direction by opening up the bylaw and removing the requirement of face coverings for people 12 and under in public spaces, or we could collectively exercise the clause in the bylaw that allows the city manager to exempt those 12 and under from the requirement of wearing a face covering. So there is an option of doing this without formally changing the bylaw. The government of Alberta will lift the face covering mandates for all Albertans on March 1st, according to their plan, provided that hospitalizations continue to trend downward. In this case, Council could choose to end the city's temporary mandatory face covering bylaw in conjunction with the provincial direction, or maintain a face covering mandate in all city facilities, or maintain a face covering mandate just on transit and in transit spaces, or maintain the bylaw in all public spaces. We have heard from transit riders consistently that they support masking on transit. They want to be able to ensure their safety and comfort in a setting where crowding is more likely to occur. Effective February 9th, there is a 50% capacity limit in large facilities and entertainment venues of over 500, but food and beverage consumption is now allowed when seated as well as during intermission. Capacity limits for locations under 500 that were not covered under the restriction exemption program are removed. As of March 1st, there will be no capacity limits on venues. Restaurant and bar interactive activities permitted, and the examples of this are dancing, darts, and billiards. A resumption of regular liquor service serving and consumption times, all on March 1st. Options for Council's consideration are aligned with the direction provided by the province and have no capacity limits in facilities in Edmonton. Maintain capacity limits of 50% of the fire code in all City of Edmonton owned and operated indoor facilities, or implement capacity limits in all indoor public facilities across the city. Now, I want to assure you that the city will continue to do all we can to keep our city employees safe. As an employer, the city has an occupational health and safety responsibility to ensure employees are protected in the workplace. That includes setting safety measures that are sometimes different from public health restrictions. As a result, when public health measures are lifted, our COVID-19 workplace controls will continue for a minimum of 4 weeks. The controls include pre-shift screening, face coverings, physical distancing, and we may continue with some of those controls for longer if needed, based on our own occupational health and safety assessments of our workplaces. As previously communicated to employees, staff who are temporarily working from home will return to city workspaces 4 weeks after the return from home order is lifted, and leaders of these teams will return during this period to conduct inspections and prepare for the return of their staff. And as you know, we have also, when we do return to work for office workers, we're going to implement a modified work arrangements that do allow people to work from home up to 3 days a week. We understand that returning to workplaces and the easing of public health restrictions will be an adjustment. Continuing our workplace control measures while we take time to assess the new situation will allow our staff to feel safe and minimize the transmission of the virus. At the same time, our staff have been excellent in protecting themselves and our patrons through high levels of immunization and are encouraged to stay home if they are feeling unwell. I also want to thank once again all those employees, over 70% of our workforce, that has diligently come to work throughout the pandemic and served Edmontonians throughout the pandemic because they don't have the option to work from home. They have kept services going and have done all they can do to combat the pandemic at the same time. Last week, when the Premier mentioned potentially amending the Municipal Government Act to address municipal politicians improvising their own local policies, we started to look at the legal aspect of the pandemic, and we found the following. A municipality's powers under the MGA are very broad and grant council substantial authority to pass bylaws with respect to the areas including safety, health, and welfare of people and activities in public spaces here in Edmonton. A municipality is able to pass its own bylaw dealing with the same subject matter as a provincial regulation concerning COVID restrictions, so long as its bylaw does not create a conflict or inconsistency with provincial legislation. A municipality generally has the authority to impose more restrictive requirements than the province, but cannot relax provincial requirements. Accordingly, when the province removes restrictions, a municipality is permitted to impose its own restrictive measures. The province has the ability to amend the Municipal Government Act in order to prevent the city from enacting its own measures. This would require the province to include an expressed and very specific prohibition targeted at such a program. That is to say, the province would have to specifically legislate an express prohibition as an exception to the city's general bylaw making powers and would require the passage of specific new legislation to achieve this result. And that requires the province to be in session. I'm happy to invite the city solicitor, Michelle Plouffe, to speak more about this when we get to the questions portion of the presentation. We do feel it is prudent to mention that should council choose to implement more restrictive policies, it may be difficult to defend why the city would continue to increase restrictions at the interpretation of the data used to inform the measures, whether for implementation or elimination, are currently interpreted by the Alberta Health's Chief Medical Officer of Health. There is also a risk that there will be more individuals who disagree, although given how polarizing COVID-19 has become, this is possible regardless of which path council may choose. Before I conclude, I would like to take the opportunity to speak directly to council and to all Edmontonians. And for those of you who are looking for steps you can take to adjust to these changes, and for those of you who are uncertain, please, I urge you to go back to the basics. You are not powerless. Get your first, second, or booster vaccine as soon as you're eligible to do so to protect yourself and those around you. Stay at home if you are sick or symptomatic. Use a rapid test kit if you can get one to test if you have symptoms. Wear a high-quality, well-fitting mask, and you can wear a mask anytime you want. Physically distance when in public spaces. Limit your personal gatherings, and wash your hands often. These are the same messages that we've been saying for 2 years now, and for good reason. They are practical, they are common sense, and they go a long way in protecting the health of yourself, your family, and your neighbors. So we will now stand ready to answer your questions and work with you to develop motions that provide direction on the potential options at hand. I would ask that if you want us to create or amend bylaws to implement these options, we will need some time to ensure they are properly crafted and practical for Edmontonians. And with that, we're happy to take your questions. Thank you very much.
Thank you, Mr. Corbold, and quickly, can you touch on if there is any consultations with our administration from the province?
No, there were none.
Okay. And there were no consultations with us at a political level as well, other than heads up half an hour before the announcement was made. I think Edmontonians needs to know that because we were not involved in this process and we were never consulted and no data was shared with us behind the decision-making process. Okay, all right, so we'll go to questions to Council. Councillor Knack.
Thank you, Mr. Mayor. You touched on the one thing, because Mr. Corbold, right at the end, you did talk about if we have different rules in place compared to the province. They use data to help inform that. But just to be clear, not only have we not been consulted, I want to make sure, have we received or is anyone aware of the recommendations made by Dr. Hinshaw to provincial cabinet for these latest set of changes? Is that publicly not available information?
Andre, your mic is off.
Sorry, Councillor. Administration has no knowledge of that.
Okay. Dr. Skor, I don't want to drag it in too much, but I just want to, like, do you, I think in the past we've talked about that, you don't get access to those recommendations either. Your role is the sort of follow through on what the decisions are. Is that correct?
Yeah, that is correct, Councillor Knack.
No, thank you. That's fair. So that means, just to be clear, that means we're not all operating with the same data, and that does create a bit of a challenge for this conversation. Dr. Sikora, a few questions. Is there any peer-reviewed data that we have that would suggest the transmission between those who are have not received the vaccine versus those who are fully vaccinated, that the transmission is the same? I hear that suggested from time to time, and I don't think I've seen anything peer-reviewed that would suggest that's actually true.
So it's the assumption that individuals that are under immunized or not immunized transmit more easily than those that might be.
Yeah, essentially, I do get some emails from people saying it's the same. So if you're fully boosted, that you are transmitting at the same rate as somebody who is not. And under the Delta variant, I know that was not the case. I think there is plenty of peer-reviewed evidence that showed that not to be true. Do we have anything with regards to Omicron that suggests either way?
I believe it would very closely mirror the Delta experience. If you are immunized, you are at greatly decreased risk of having severe illness, greatly decreased risk of having hospitalization, but also greatly decreased risk of having symptoms, and which those symptoms would also be related to possible probability, or at least chances or likelihood of transmission to other individuals.
Fair enough. Yeah, I know there's just a new study out of the University of Copenhagen, which hasn't yet been peer reviewed, but they released it a bit early, that's suggesting the same thing, that the transmission is lower for those who are fully vaccinated and boosted specifically. And you just touched on the other piece, which is that it is clear, based off even our current numbers in Alberta, that those who are fully vaccinated and boosted are at substantially lower risk than those who are either well, particularly those who are unvaccinated, because I think the cases per 100,000 over the last 120 days on the Alberta website shows there's quite a big difference. That's your understanding of the stats that are out there today?
Yeah, that is what the data is showing. Vaccines work, and they're very, very safe and very effective against preventing hospitalization and severe illness.
Right. So here's the tough question that I'm struggling with, because I appreciate that these decisions that are being made, and it's not just in Alberta, I realize it's happening in other jurisdictions, are this living with COVID. We've talked about this now, even in today's presentation. I guess I don't fully understand what that actually means, in the sense of what are the impacts of that decision. So, for example, a question that I don't know if we know an answer to yet, but based on the numbers that I see, even with those who are fully boosted and who are fully vaccinated and boosted, is that it appears we still see, say, a greater number of deaths compared to something like the flu. So, are we making an assumption in this new normal that COVID is maybe going to become the new flu? And if so, that will result in a greater number of deaths. We might have to be willing to accept that as a society, but I don't know if we've understood what that actually looks like, and then compared that against, economic impacts, mental health impacts. Has there been that type of analysis done to help us understand what the actual consequences are of living with COVID are? And I guess I'll start with Dr. Sikora, and then I'll be out of time.
It's a difficult question, Councillor Knack, and it's a very good question. So a shift from pandemic to endemic is something that's expected, and something that I think every province, every jurisdiction does have to contend with over time. The suggestions from our Public Health Agency of Canada do bring forward the notion that COVID will become an endemic respiratory virus, something that circulates around the globe, around our communities, around our province, around our country over time. And likely we'll have these subsequent waves that'll change over the upcoming months to years. Much like how over our I guess recent recorded history of having influenza come around every fall to winter, almost like clockwork. What's different and what that shift to endemic means is that we prepare for that. We prevent as much as we can through a whole host of different resources and interventions at this point in time. One of those key interventions being immunization. So with subsequent waves or subsequent future waves of COVID, there will be recommendations from our national advisory committees on how to utilize which particular immunizations to help protect our populations. Those recommendations will come to individuals, to age groups, to those with particular risk. Yeah. We've seen an expansion of the tools and resources that all of us have to help prevent transmission events. The much more commonplace notion of wearing a mask to protect yourself, protect others. It works for COVID. It also works for RSV. It works for influenza. And it works for many other respiratory viruses. Yeah. Advent of hand washing becoming much more common. We reflect on our experience in our hospital environments. Hand hygiene rates within hospital facilities has been at an all-time high over the past 2 years, which is excellent because that reduces the chances and the probabilities of hospital-acquired infections.
I'm going to stop you there for a minute.
Changes in our use of antivirals and other treatment modalities to help treat those that are very sensitive to bad outcomes from COVID-19. Yeah. That is expected to continue into the foreseeable future. And we've also seen changes in how we work in our workplaces. Work from home, stay home when you're sick, safe for work screening are all those things that are going to likely continue with us as a society going forward about how we do manage in an endemic nature.
Yeah, thank you, Dr.
I'm going over time, sorry.
No, thank you for that. I way over time, right? So, but I think there was the good points that you made. I think we benefit all benefit from hearing those. Thank you so much for that, and for your expertise on that. And go to Councillor Paquette next.
Yeah, thank you, Mr. Mayor. Just one correction, Dr. Sikora. Not all ages can be vaccinated yet. Okay, so really simply, if a virus can replicate, there's a chance it can mutate, right, Dr. Sikora?
Yes, that is correct.
Yeah, and we've seen that multiple times now. So let's cast back all the way to June of last year, when we were faced with a very similar situation where restrictions were being lifted because cases were going down, hospitalization was going down, so restrictions were lifted. Much like they were lifted every time we had a downtrend so far. What happened in the fall after restrictions were lifted with COVID cases? Increase or decrease? Oh, you're on mute.
Apologies. We did have a Delta wave at that time.
Yeah. Yeah, we did have a Delta wave at that time. And here we are in an Omicron wave, and we know that more variants are coming. So does living with COVID mean giving COVID a free ride so it has a chance to mutate further?
It's a fair question. So COVID will mutate, much like all of the SARS-CoV-2 type viruses. It will mutate over time, just as influenza has. So the expert opinions are that COVID is much more likely to become an endemic virus. It's not something.
Yes, it is likely, but are we sure of the timelines yet?
So it's not amenable to elimination, and that's part of the challenge with this.
That's right. So scientifically, we're not sure of the timelines. We don't know when it will become, when we will see a mutation or a situation where COVID becomes like the flu, if ever. But we do know that mutations are still occurring, and we don't know yet what the severity of those mutations will be. Does that sound about accurate?
Yeah, I think that's accurate.
Yeah. Okay. Mr. Corbold, you mentioned something about the QR codes becoming inactive potentially. I'm just wondering how that fits into a scenario where people need them for travel internationally.
Yeah, we believe that it will continue to stay active for that reason. So what we've been told is that we know the app is working this morning, so we can use it to check QR codes. We think it will carry on. I just can't guarantee for how long, and I don't know yet if other people can download that app for use. Now, we've got it all in our facility, so we can continue its use.
So I think it's safe to say that as long as international travel mandates are in place, we'll probably still have a QR code. One would imagine that we would want to allow our citizens on a provincial level, the province would want people to be able to travel internationally.
I think that's a fair statement, and that's our sense.
Yeah. Okay. So there's a lot of mixed emotions, obviously, among Edmontonians. The vast majority think that this is too fast. And we've been burnt by these premature moves multiple times before. There's no secret there. So I'm just wondering, for businesses who want to continue with the REP because it helps them and helps the people feel comfortable going out to these places, what can the city do to assist these folks, understanding that some may not want it, and also understanding that there's a concern that frontline workers will take the brunt of a minority of people who may verbally assault them? How can we support cities or businesses within the city who want to maintain REP?
I'm not sure of what else we can do. They have done it essentially without direct support from the city up to this time. So I can't think of anything else we can do to support them to implement it on their own.
Okay.
Other than creating regulation that forces them to, which you can do from a bylaw perspective.
So we'll have to put our thinking caps on for that. I think it's safe to say, though, that we already know the majority of Edmontonians feel safer with these restrictions in place, and they shouldn't be made to be afraid of going out because they may face some kind of abuse. Okay, so next question then is
Time of Constable Paquette. Time.
Oh,
is
I'm out of
out.
time. Okay,
is
thank you.
out. Sorry, Constable Wright.
Hi, thank you very much. Dr. Sikora, just sort of following up on Councillor Paquette's line of questioning about, in comparison to when the province felt we were open for summer, how does the data compare at that time as far as vaccination rates, level of infection, hospitalizations? How does that compare to where we're sitting at today?
So comparing summertime to now, I would say that our immunization rates for adult is much higher. Immunization coverage for 12 to 17 and that 5 to 11 is new, and that was brought on board over the fall and winter time. We have at this point a different variant, so Delta versus Omicron. So Omicron being much more easily transmissible but less severe. So we also have differences in what we have observed within our critical care and our inpatient environments, with less, albeit more highly transmissible. There is less pressure on our critical care as an ICU infrastructure, and perhaps more pressure on our inpatient facilities, inpatient resources. So different population, better protected at this point in time, and then not as great of an impact, but still a great impact.
Better protected, or I'm just because at back in the summer, we only had the access to the second dose. And I'm just looking at the slides from the presentation. And right now, the third dose, we're only at what, 39%? Isn't there a better level of protection with the third dose than there is with the second? With just having
There is. 2 doses does impart a fair deal of protection. Third dose is better for Omicron specific, but it doesn't drop off to zero. So we have better coverage, but also that third dose is something that was added over the fall and winter months.
Okay. And if we're looking at the impact on the healthcare system, should we just be focusing on the acute care facilities, hospitalizations and ICUs? Or do we need to look at the entire healthcare system as far as long-term care, assisted living facilities, even the impact on other facilities like our rebound center and that? The information that's available to us on the government site for the Edmonton zone, it looks like total number of facilities impacted by an outbreak right now is about 157. Is that correct?
There are a large number of facilities that are currently on outbreak. I think the reproduce, or at least the number that is, those numbers and components that are consistent over time would be our inpatient hospitalizations, or so critical care and inpatient use. That's something that we can track and have been tracking easily over the past several years.
And what's the impact to those healthcare workers? Again, not just like, do we have any data on number of absences, number of healthcare workers that have contracted the disease?
There is internal numbers on our absenteeism in our workforce, just that AHS specific, and I don't have those off the top. I don't have those handy. I'm sorry.
Okay, but that's just AHS. So if it's a private facility, you don't have access to that information.
Generally, no.
Okay, so we're really not able to assess the full impact, I guess, on our healthcare system. Is that right?
We know it's a huge impact. A lot of worker stress, a lot of caregiver stress as well. A lot of outbreaks, but at the same time, there's been a huge amount of work undertaken to be able to make for these safe environments as much as possible. So the screening, the hand hygiene, environmental cleaning, the ventilation are all key things that will continue. It's along with the masking and use of personal protective equipment to be able to make these places as safe as we can.
I'm sorry to interrupt. I do just have one extra question and my time is running out. Looking at the current status for Edmonton zone, I noticed there's a big jump in January as far as hospitalizations and ICUs. Is that because it was changed that reporting for hospitals in our zone changed from being just specific to originating in our zone, or is it because it expanded? Doesn't matter where they came from in the province.
I believe that was due to a statistical measure that Alberta Health was working through with the data, and I think that was explained by Dr. Hinshaw a couple of weeks ago. And I'm sorry, I just can't remember the specifics off the top of my head. Okay. Edmonton zone does serve as almost a funneling point for much of our northern Alberta and central Alberta communities. So our critical care, as well as our inpatient bed utilization, is also taken up by many out-of-zone residents. So we serve much more than the city of Edmonton and much more than the Edmonton zone.
Thank you, Dr. Sikora, for that, and Councillor Wright. And I'll go to Councillor Tang next.
Thank you, Mr. Mayor, and thank you very much, Mr. Quibble and Dr. Sikora, for the presentation. A little bit different question. Mr. Quibble, do you know if we are anticipating another protest this weekend?
I don't believe so at this point, but I don't have specifics, and I'm not sure how last night's announcement by the province may have changed that dynamic. So I can tell you that we're watching closely. The other thing I can say is that we had expected a convoy to be in town yesterday, and from a couple of different communities outside of Edmonton, and it arrived, but it was about 5 vehicles, so was not much of a protest. I don't have any latest information about the weekend at this point, but we're monitoring it closely for sure.
Cool, thank you. And Dr. Sikora, so yesterday the Premier mentioned that this decision is not based on political pressure, but it's really based on what other jurisdictions are doing around the world, in Canada, in Europe, and a lot of blue states in the US. I'm wondering if you can speak to that a little bit. How do we compare? And is the evidence sound to say that, you know, these places are lifting and therefore we should too?
So I think the stepwise approach is outlined as a very reasonable approach. So the early steps, or step one is described as removing the RAP, is a reasonable measure, and I think one that is mirrored across other provinces, other jurisdictions. As outlined by the Premier, it has served its purpose. Now there are a whole host of other interventions and precautions and activities that are still in place with legislation, some of those being public masking, the safe for work, the CMOH order for isolation should you have symptoms or symptoms consistent with COVID-19 or can occur in case of COVID-19, along with those indoor and outdoor gathering restriction sizes. So those are all designed to be able to help reduce transmission events and transmission probabilities. Those are still in place. And as outlined with that step one, step two, and a future step three, I think that does closely mirror and what other jurisdictions are doing in that stepwise gauged manner to be able to help, well, transition our population into COVID being much more of an endemic communicable disease.
How do we compare on a per capita basis in terms of transmission rate, hospitalization rate, say with other major cities in the country, for these measures to be comparable?
I don't have that off the top, just at the tip of my fingers. I believe we do compare fairly closely with many other jurisdictions. Just I don't have those specific numbers at my fingertips, so I apologize.
Okay. Mr. Corbell, I'm wondering a little bit about, so the QR code is still going to be in effect for international travel, but just so I understand, you're not necessarily recommending a city level REP program because the QR code is health record related, held by the province, and we don't necessarily have the same technology and database to enact that, and that's why you're recommending the active screening approach?
Yeah, so perhaps I'll just be a little clearer. We're not recommending implementing REP or not implementing REP. It's an option that council can choose. In the meantime, we have taken the decision to start doing the active screening because we can, and it's a helpful, effective piece. And on the apps, I just want to be clear, the app and the way you download your QR code based on your AHS records is one thing. What I was talking about is the Reader app that we have downloaded and are using in our recreation facilities, and most businesses are using in their areas. That is still That app is still working. I think the QR code download will always work for travel and things like that. I think the specific REP app, which is your screening app that reads the QR codes off of people's phones, is still working. I just don't know for how long it will. But I also want to say that without that app, we could do REP. We've done REP before the app existed for several weeks. It's more logistically intensive and requires more manpower. It's a little slower, but it can be done.
And then when you say active screening, is it a questionnaire that people have to fill out? Is it a matter of asking them? Are you taking temperatures?
It's a bit like the same screening we were supposed to do every day before we come to work. If you have symptoms, and we're asking questions, and that's gone very well this morning, is our understanding from what's going on in the rec center. So, and if you're coughing and you're sneezing, we are going to ask you to go home, which is in line with the current health direction.
Thank you, Councillor Tang. Councillor Stevenson?
Thank you, Mr. Mayor, and thanks for the presentations this morning. I have quite a few questions, so I'll try to move through them as quickly as possible. Dr. Sikora, I heard you mention that, you know, there's the choice to get vaccinated at every age. Now, just want to confirm my understanding that there still are no vaccinations. Is it 5 and under or 2 and under?
The 0 to 4 is still pending from our National Advisory Committee.
Okay, and do we have a timeline on when that will be available?
I don't have a timeline, I'm sorry.
Okay, so there's still a segment of the population that doesn't have the option for vaccination. Also, I'm just wondering, so I understand that the second step that's scheduled for March 1st will be relying on hospitalization data. Recognizing that hospitalizations are a lagging indicator, will we have time to, does that provide sufficient time to understand the implications of this first step?
I think all of that information will be taken into consideration when Dr. Hinshaw and the public health staff do brief the decision makers at Government of Alberta. And I think that they'll continue to watch both the hospitalizations, critical care usage, but also other indicators like test positivity within the testing environment, along with, for example, things like the wastewater surveillance monitoring systems.
Okay. I just want to follow up on a couple questions that my colleagues had asked as well. Councillor Tang had spoken about comparison to other jurisdictions. So there are other jurisdictions that are removing REP at this point?
I think many other jurisdictions have either are moving to removing their RDP-like or vaccine passport systems or already have.
Okay, and then just in terms of the contextualizations, the current hospitalizations, I think this week I heard 641 in the hospital and 61 in ICU. And can you just benchmark that against another point in the pandemic? How it compares to the peak of the fourth wave or just some sort of contextualization there?
So our overall total hospitalization, and I guess, do we have the graph over, I guess, to administration, do we have those graphs handy from our provincial counterparts?
Maybe if that can be pulled up, I'll just move along with the time. Just wondering as well, you know, we've been talking about economic impacts. Just wondering if the economic impacts of being away from work or needing to care for children who aren't able to go to daycare or school have been factored into the economic impact analysis. And also for keeping our critical services going as well in terms of members having to isolate.
Yeah, Councillor, maybe I'll start by saying across the entire city, hard to assess that because of access to data. I think we have a very good handle on that from an employee perspective because we are able to access all that data. So we're in good shape right now in terms of services and across the city, but very difficult to do the economic impact on the other piece just because of lack of data.
Okay, well, maybe Mr. Corbold, I'll carry on with you as well. So I noticed that there's a month delay in the change of the provincial regulations until our workforce measures are changed. Could you explain the rationale for the month delay that administration has taken?
Yeah, so our perspective has been that is all based on our own internal occupational health and safety assessments. So they're done by people in the system doing assessments of the workplace. Part of the reason we want it to be gradual is we wanted to give employees some time to adapt to the change. So we've said we're going to give you 4 weeks when the mandatory orders lifted. That gives people time to arrange childcare, to arrange their schedules because many have been working from home for a long time. The second thing is we want leaders in the organization to come in first to, again, do real good detailed occupational health and safety assessments, which is in accordance with the law, and to make sure that everything is in place to protect employees. And rather than rush back to work, we thought a period of 2 to 4 weeks is a reasonable time to get people back to work in the workplace and get comfortable with it. So that is the 4-week process. Leaders come in first, we do assessments, we prepare for employees to return, and then they return in a very safe way and get comfortable with their space.
Great. So really hearing that time and just taking a bit of extra time provides for a smoother transition. I know I can't see the clock, but I know I'm running out of time. Mr. Copeland, you also talked about GBA Plus and some of the, service workers having to take the brunt of maybe frustrations around that. Just wondering how additional exposure to COVID factored into that analysis, because it seems to me that those service workers, without any restrictions in place, will face higher levels of exposure. Also, individuals experiencing homelessness, elderly, and children who can't be vaccinated. So if you could just walk me through that logic.
Yeah, I think it's a factor for sure. I think the fundamental point from my perspective is that it's one thing to ask a frontline worker, and in some cases these people are 17 or 18 years old. It's one thing to ask them to check and enforce a mandate that has got a public order, health order behind it, and there's been some very reasonable and collaborative cooperation from Edmontonians to do that, which is why it's worked well. I worry without that whether we'll get the same level of collaboration. I agree that there could be enhanced exposure of people who are not vaccinated without an REP program, which is one of the reasons we've instituted immediately this morning our checking for symptoms, because we know for a fact there are people that have COVID that are in our rec centers and in our restaurants because they have a vaccination proof as well. So in some cases it's better, not better, but it's helpful to do the symptoms checking. And that could be more powerful than just checking for vaccines.
Thank you, Mr. Corbould. Thank you so much. I'll go to Councillor Principe next.
Thank you, Mr. Mayor. Dr. Sikora, could you remind me how many ICU beds do we currently have in Edmonton?
I think our baseline is in the 70s, and we are using our exceptional capacities. We have increased beyond that and continue to be beyond that at the time being.
Wow, so we're fairly close to capacity then.
Yes, that is correct.
All right. But as I understand, you say removing, or you believe that possibly removing the REP is a reasonable measure at this time?
It's a reasonable measure at this point in time. There are other restriction measures already and continue to be still in place, including the symptom checking, but also the masking and for indoor place mandate across our population, along with others.
Okay, all right. So continuing with the public masking, as you said, is a measure that you think we should continue?
It's continued by our provincial counterparts, at least until the end of February. So yes.
Oh, great. And for the wastewater analysis, we have already reached the peak, is that correct?
I think we should be able to put that up on the screen as well. The wastewater peak is something.
Yeah, I thought it's kind of, yeah.
It is a fairly jagged peak, but it is showing it did show a clear upswing and now a downturn over the past several weeks or so. But we are on we appear to be on the downslope of the wastewater peak as well.
All right, all right. Okay, I think that's my only questions for right now. Thank you very much.
Thank you, Councillor Principe. Councillor Salvador.
Thank you, Mayor Sohi. So we'll start with Dr. Sikora. Just building on the questions around wastewater data, understanding that, yes, we may be sort of coming down from that peak, but how does that compare to previous waves? Do we have data from wastewater from previous waves?
So wastewater has been continuously monitored over the past year or so. So we do see a fairly broad peak for our Delta or fourth wave. Similarly, a very broad peak over the third wave. And then this Omicron or fifth wave does show a very high, narrower peak, so likely indicative of much more community-based transmission, which would mirror Omicron's much more easily, its ability to be more easily spread around our population overall. So it's a rapid rise and looks to be a fairly rapid decline. And then again, as indicated by the other councillors, yes, the hospitalization is a delayed indicator, but is something else that we're also very closely monitoring.
Right, and just to really dig into that, based on where we are right now, again, recognizing it's on the decline, if we were to look back at previous waves, are we at a comparable level to that decline, or is it still higher than previous waves?
So the critical care usage is lower than previous waves, and if that graph could be put up, we'll be able to walk through that perhaps. So our Omicron Omicron critical care usage has been lower, which is in keeping with its less severe, it being less severe of an illness. But there has been a greater number of hospitalizations around that inpatient or non-critical care space that did reach a peak about last week, and it is on the downturn, but still, of course, very elevated. Our hospital environments themselves, albeit strained, are managing at this point in time and should continue to manage as well.
Okay. Okay. And I am aware of my time, so I just want to go to another question around vaccination rates for children 5 to 11. My understanding is that Alberta has the lowest vaccination rates for children 5 to 11 compared to all of the other provinces, territories. I guess, could you just verify that first? Is that correct?
I haven't seen the recent numbers for immunization in the 5 to 11 age groups from other provinces. Alberta's is, I think there's room for improvement, and certainly being able to entice and communicate to parents that immunization is a safe, easy, smart, and very useful choice to protect their children is something that has been ongoing.
Right. Yeah. And there's definitely that communication piece. I also am still wondering about access. I know that we're not doing vaccination in schools. Can you just, I guess, explain the rationale for that?
So school-based immunization is something that we do for our usual sort of childhood scheduled immunizations. We have teams across all of Alberta that do undertake that. In our experiences over the fall and winter months, the school-based immunization doesn't pick up a large number of willing participants, but of course is something that we can continue to have discussions about.
Okay. Yeah, and just to Mr. Corbould, really quickly, wondering, understanding that, with the restrictions exemption program, access to data and the sort of ongoing updating of the app is a pretty important part of this conversation, but we do have the ability to do it without. I guess, are there any pathways to improve our access to data at this point? It sounds like it's been fairly limited so far.
Yeah, I don't believe so. We continue to request all the data we can get, and we look at all the data we do get, but we're not privy to all the data behind some of the decisions that go to the province. Yeah.
Okay. And just finally here, I want to be just really clear. So I understood that, Mr. Corbould, in your presentation, we're within our right to go sort of above and beyond what is required by the province. But did you say that there's also an issue if there's an inconsistency, or did I misunderstand that?
I did say that the inconsistency is focused on us not following the provincial. We are allowed to go above and beyond. We have done that several times throughout the pandemic and have not been challenged on that, including with our bylaw on mask face coverings.
Okay, thank you very much. I'm out of time.
Thank you, Councillor Salvador. Councillor Rutherford.
Yes, thank you, Mr. Mayor. I want to start with some questions actually towards legal today. So I see that you've got considerations for city and provincial, but I see a gap here with federal and specifically charter, because one of the things that specifically talks about in the federal legislation is that municipalities have the authority directed by the province, but cannot go against the Charter of Rights and Freedoms. And I'm bringing this up because I dealt with this exact issue with conversion therapy and bringing that bylaw forward in the municipality I was working for. And I feel like it's an important context that's missing in this discussion right now. I think with masks, it's been proven that was the minimal impact to people's rights was less than the overall public health benefit. But if we are without the data and the context from the province to know what the public health impacts are, and we're talking about kind of this segregated piece, it is, and the free movement of people across the city, is that more dicey territory, legally speaking?
Thanks, Councillor Rutherford, for the question. There is no doubt at all that we would be opening up the city to charter challenge in the event we put our own RAP program in place and enforced. So it really, I do think, enforcement by way of tickets or other similar action, we are always subject to the charter, and that would be a risk that we would be monitoring very closely.
Because it talks about, within the limits of a free and democratic society, in your legal opinion, is this within the limits of a free and democratic society?
Well, I think that's the hard question.
It is, isn't it? But I think it's an important context that's missing in this discussion right now. So I wanted to bring it to light.
Right, and we would be needing to rely on evidence and data to support our position.
To be able to say, if we were challenged as a municipality and as a decision-making body, that we were acting within the best interest, we have to have the data to back that up to uphold a challenge.
Correct, and being aligned with the province as they had their RAP program, we were we could go on their skirt tails, right, just to make sure that they've got the data. We were based in evidence. So I think going out on our own, there is a risk of a successful challenge, but I can't assess the level of risk at this point.
I know it's been a lot to come through in a very short period of time without any notice to think about these things. My next question is to Dr. Sikora, just around, one of the options for the mask bylaw is the removal of the under 12. And right now our mask bylaw is 2+ to wear a mask in public spaces. And I know right now there's still the provincial, but it is excluding 12 and under. And I think about the letter that the Minister of Education sent to school boards, basically nullifying any decision-making authority for school boards to enforce a mask mandate in schools. So I guess I'm just looking to you with, if children under 12 are not wearing masks in schools, but they are required to wear them in public, does that actually support public health? I'm just trying to get some guidance on that. Because they're all convening in a school without masks, but they're required to, if they go to a grocery store, to wear a mask.
So I think when we look at many of these environments, we also have to look at what other controls are in place to help prevent transmission and keep individuals safe. So within many school environments, we have physical distancing, environmental cleaning, and safer learning screening as other control measures to help reduce transmission events, transmission probabilities. Schools also have access to rapid antigen tests as part of that. As a tool.
I'm not saying there's no controls in schools, but as a parent of young children, 8 and 10, I can tell you that those social distancing regulations are likely not adhered to as much as we're making this out to sound intellectually. So I apologize, but I respectfully disagree with that comment. And I'm out of time, so I will come back for another round.
Yeah. Thank you, Councillor Rutherford. Councillor Jans.
Thank you. Just Mr. Mayor, are we in questions or debate? What's the process here?
We are in questions to admin and to Dr. Sikora.
So there's no motion on the floor at this time?
No, not yet. No, I think let's get through one round at least, so everybody has a chance to ask questions.
Okay. Well, just in the interest of agenda management, I seem to be hearing consensus through a lot of this, though, that there seems to be a high interest in seeing a number of measures reinstated. I was wondering if the city manager or Dr. Sikora could tell us when is the date for Jason Kenney's for the UCP leadership review?
I don't think that's really a fair question to Dr. Sikora. Maybe city manager can answer that question.
I have no idea, but we can try to find out if it's published somewhere.
Yeah.
Yeah, I guess, does anyone really believe that this would be happening if it wasn't for a few truckers, air quotes, down at the border who blockaded the border?
Again, Councillor Jens, I don't think that's a fair question to administration. That's more a political question that I understand where you're asking this question, absolutely. But I don't think that's a fair question to our administration to answer or Dr. Sikora to answer. Sorry about that.
I guess the problem is even as soon as last week, the premier was saying restrictions would be coming off in March, mid-March, late. So I'm wondering what changed over the weekend or since the convoy started. Did new health information come to light? Did something change?
I'm just simply not aware of those discussions at the province, Councillor, so I'm not privy to any of that.
Yeah, we were never consulted or advised on this, Councillor Jens, so it's difficult for any of us to answer these questions. Yeah.
Yeah, it just seems like it's come out of nowhere that the premier and all parties have been saying we would be relaxing eventually, which I certainly support eventually when data shows it. And now this has just been sprung on us without consultation. And the only things I can see changing here are the trucker protest at Coots and the premier's leadership review. So I'm struggling to piece this together. I guess then maybe another question. Why do we keep saying the word restrictions? Are these not protections? Are seatbelts not a protection? Are airbags not a protection? Are fire alarms not a protection? Why are we using the rhetoric of restriction?
I would say, Councillor, that we're just using the named program that the province has put out there. I understand your point, but I don't believe the city has used that word, but when we refer to the provincial term, we do refer to the named program that they have advertised and put out there. And it does look like that vote is on April 9th, according to the CBC website.
Okay, thank you. I guess my other question is if I think we're all sympathetic to the concerns of frontline workers. I wonder, though, if I've seen people who have chosen to wear masks out in public, like out on the sidewalk or something, or heard about them being accosted and bothered, and I've certainly heard about instances in stores, and I wonder to what extent should we be encouraging if the workers are not feeling safe and feeling protected in an Edmonton business, what steps can we do to help them either unionize, strengthen their labor rights, enforce that? Like, shouldn't this be, I heard about an incident at a superstore. Shouldn't it be the responsibility of the management and the ownership of Superstore to protect the workers rather than us making public health decisions for the entire city based on, it seems inverted. Is that fair?
I would say that employers are required to make sure their employees are in a healthy and safe environment through the Occupational Health and Safety Code. I think we've seen a lot of that, and a lot of our businesses and managers and leaders in the community do that very thing because I think they treat that seriously. And for the city, we certainly focus on that with our frontline staff and make sure that they're they're being protected and kept safe when they're doing what we're asking them to do. So that is absolutely an obligation. I don't think that there's anything else we need to do as a city because that obligation is enshrined in the Occupational Health and Safety Code, and it's very clear.
Yeah, thank you, Councillor Jans. Councillor Cartmel.
Thank you, Marsohi. So I kind of want to pick up on Councillor Paquette's thread a little bit, and he was talking about, not to speak for him, of course, but about reducing transmission being the goal, to forestall further mutations and variations. So I guess to Mr. Sikora, just a few sort of simple questions to sort of disaggregate this. If we separate out those that are displaying obvious symptoms and not allow them to join the group, whether it's in a restaurant or a hockey game or what have you, that's a good step towards forestalling transmission. Fair to say?
I think that's fair. So symptoms, you should isolate, and under the CMOH orders, you must isolate for a 10-day period. minimum.
Right. So, and I'm kind of asking these questions in the context of the RAP program. So, the RAP program isn't required to separate out those that are demonstrating symptoms.
That's correct.
And you did say, Mr. Sikora, if I've got this correctly, that those that are not vaccinated are more susceptible to symptoms, or their symptoms may be more severe.
They're likely to have a worser outcome and likely to also have an increased viral load, which could increase transmission.
Right. So if someone is clearly demonstrating symptoms, they're more of a threat, for lack of a better word.
That's been, yes.
So there's also then the possibility that a person is asymptomatic but still has COVID and is transmitting COVID or could transmit COVID.
That can occur, and we do see breakthrough infection even amongst those that have been immunized.
So, but there's no data available that says that an asymptomatic non-vaccinated person is more contagious than a asymptomatic vaccinated person, right? If you're asymptomatic, if you've got it and I don't know, Dr. Sikora, then it doesn't really matter about your vaccination status. If you've got it, you got it. And if you don't have symptoms, you could still be transmitting. Is that reasonably fair?
I think that adequately describes a lot of the difficulty that comes with more specifically the Omicron wave that has a fairly short incubation period and is more easily transmitted. So those with symptoms can transmit. In some occurrences, those without symptoms can transmit even though they are infected.
So the prevention that have adopted for 2 years on that score is to wear a mask. So I wear a mask so that if I'm asymptomatic, I'm not giving you what I don't know I've got.
That is the purpose of wearing a mask, to protect other people from yourself, but also protect you from other individuals around you as well. So
if we're looking at diminishing opportunities of transmission, masks plus symptom screening sounds like the things to be doing.
And those are the measures that continue to be in place under our provincial guidance. Yes.
Right. So the RAP program was separating out those that are vaccinated from those that are not. Perhaps out of an abundance of caution in terms of transmission, but also to try to drive vaccination rates up. But it would seem that vaccination rates, at least amongst adults, shall we say, have plateaued, where we've got as many as we're going to get. Is that?
I think that's accurate, yes.
Yeah, and I'll just add, Councillor, that I think that is one of the really strong effectiveness of the REP program at the time it was instituted. We did see a jump in vaccination rates because of that.
Yeah, but going forward, attaching that potential to the REP program it's probably diminishing returns. We're in the world of diminishing returns.
I think that's a fair point.
Yeah. So I'm also interested in the comment you made, Dr. Sikora, about the data fields. I'm looking at slide 4, and we've got vaccination rates that have for 2 vaccinations, roughly 84%. We just agreed that those probably aren't going up much higher. And that's the population of people that is measured against the population of people that live in the region. Yes?
Yeah, within the Edmonton zone. Yes.
But the hospitalization and ICU population are those in the hospitals, and those do not directly match in terms of populations. Correct?
Not perfectly matched, but fairly close.
So if we got vaccinations to 100%, we might see some reduction in hospitalizations and ICUs, but we would still be gathering hospitalizations and ICUs from our acute care catchment area, which extends all the way to the Northwest Territories, correct?
Yep.
And we don't really know how much of each we've got, really.
That isn't an externally reported measure overall.
Yeah. So I'm not trying to justify or rationalize anything. I'm just trying to figure out, where from here, regardless of political motivations and all the rest, what's the best thing for us to do? Maybe one more question on this round. To legal, first of all, you spoke I'm trying to go quick. You spoke a little bit about that we might be exposed to a charter challenge on the RAP program. Would we still have the same potential challenge on a mask bylaw going forward? And I guess I better stop there. That's my question. Thank you.
Yeah, I mean, I think, Councillor, that, you know, there is always that risk. But, you know, we currently have the provincial restrictions, and I think the evidence around wearing of masks is clear. You know, the benefit of mask wearing. So the medical evidence, I think, is clear to support the continuation of the masking piece. And I don't know if what Dr. Sikora wants to weigh in on that, but I think we would be in a more solid position on that issue.
Yeah, I believe so. And ultimately, yes, the masks do reduce risk. I mean, a well-fitting, high-quality mask adhering to those expectations from Health Canada does reduce transmission from you as an individual who is infected to other people, but also protects you as an individual from other people around you.
Okay. Thank you, Dr. Sikora. And I'll go to Councillor Rice.
Thank you, Mr. Chair, and thank you the presentation and all other questions. And I have similar question as other councillor asked, but already answered. So I'm going to different three questions here. The first question to Dr. Sikora. Is there any data on length of efficiency of the vaccine or booster shot? And then for that information.
So there is good data on the effectiveness in the real world effectiveness of boosters, but also 2 doses of immunization overall. So it does reduce your chances of severe infection or hospitalization by as much as 90%, at least from the Delta waves, less so from Omicron in the 50 to 70% range. Booster and that 3rd dose does increase your immunity and your protection overall. So on a per capita rate, those that are unimmunized or underimmunized have 10 to 15 times greater likelihood of landing in hospital or in a critical care environment. So immunizations are exceptionally effective, and I know our national advisory committees are always looking at revising recommendations, expanding recommendations, and then to be able to best protect our population.
Thank you. I think my question is different, and so I will come back for the next the second round, and because I have other questions I would like to ask. So the next question is related to specifically this question, and based on slide 4, and we have all those charter to demonstrate the decrease, and then from active case zones and in Edmonton, and also from active case rate and also positive rates, and then for all the decrease evidence. Does this evidence enough and for our city to make the best decision to keep that consistent and with provincial announcement?
Maybe I'll start. Oh, go ahead, Dr.
No, go ahead, Mr. Corbell.
I was just going to start by saying I think that's a matter of opinion for council to consider if they have enough evidence. I would point to some of the things. So, for example, our mask bylaw is currently tied to a trigger of it being enforced when we have 100 cases in 100,000. And of course, we're well above that. So I think the data supports the continuation of the mask bylaw, which I think is one of the reasons the province is continuing it. And I do think the decreases in active cases help, but I would also caution that I'm not sure we know the exact number of cases given the way the testing results have changed, and I think we don't know everything about the testing. And I don't know if Dr. Sikora wants to comment on that.
Yeah, so the active case rate has been something that did drastically change over January. So with really being more precise in terms of who should be tested with that PCR-based test made that case numbers per 100,000 probably vastly underestimating what the true case numbers are overall. Of course, that does feed into the R value is also necessarily different as well. So we look at, and again, wastewater as being one of those important indicators that shows a very high rise and then a decrease down. It's starting to decrease down. Our hospitalization, because most everyone who is hospitalized will have a test to indicate what kind of communicable disease they might have. COVID being the one that's circulating in and around their communities at this point in time. And then the test positivity, which is, I believe, just over 30%, I think might be around 34%-ish, which gives an indication of, and again, it's a surrogate of what is the impact, or at least how much COVID do we actually have circulating around our communities overall. And just for, I guess, context, in wave 4 and wave 3, our test positivity was in the 10 to 15% range, and between waves was somewhere around 2 to 3% overall.
I have a lot of quick questions about for the option for the consideration when we make decision. I think I come back to the second round.
Okay.
And my time is out. Thank you.
No, thank you, Councillor Rice and Councillor Hamilton.
Thank you. You'll forgive me, Dr. Sikora and Mr. Corbould. My eye is twitching a bit because I feel like we've had this conversation before last year, and it was a tough conversation, I think. I hear a lot of trepidation in my colleagues' voices, and I think you'll probably agree that there is no there's no one sort of right path on this. But whatever path we choose to take as legislators, I'm hoping that you can help guide that decision-making process. So something that we heard about, I'm going to say a year and a half ago, from some medical professionals, is that when it comes to putting in measures, whatever measures there are, to have compliance, there has to be a sense of fairness, like that it applies to everyone. There has to be a sense of clarity that people know what's coming in and know where it applies, and also know sort of what the timelines are. And there has to be consistency. So it has to, if it affects all rec centers, it has to be all rec centers. So my question there is, do you have any other guidance for us in terms of what kind of, I'm going to say, values, other than the ones I just mentioned, have to apply to whatever measures we do or do not implement?
Yeah, Councillor, I would go back to what I briefed this morning, which were the guiding principles, and I won't repeat them all right now, but I think those certainly are consistent with the ones you mentioned. I would say as a comment that if we were to continue with mask use, I think that does remain fair, consistent, especially regionally. I think we don't know all the details of what everybody's doing, because lots of councillors are having these discussions today and tomorrow. But our sense is that if we carry on with REP, there will be less fairness, less consistency region-wide because of the different approaches others are taking or could take.
That's helpful. Thank you. And I did appreciate your presentation this morning. Something that, again, I'm starting to see emails come into my own inbox. We're starting to get phone calls in the office. A lot of people, regardless of their perspective on what action we should take, will implore us to do our own research. And I always found this problematic personally, but I guess I look to you, and perhaps this is a good moment to look to Dr. Sikora for how should we synthesize those kinds of questions we have with the, I'm going to say, limited professional expertise that we have access to. First of all, do you want us going off and doing our own research? And second of all, what resources do we have to answer some of our questions about whether or not we're making a right decision from a health perspective?
Maybe I'll just start very quickly. From an administration perspective, we have consistently during the pandemic heeded the advice of the health authority. There's lots of doctors out there, but we have generally consistently heeded the advice of the doctors who have the word authority behind their titles. And I have no expertise to rely on other than those authorities.
And I appreciate that. One of the big struggles of this pandemic has been that there is a lot of information out there, and a lot of it is in disagreement with each other. It's very contradictory. I guess maybe the last question, and picking up on what Councillor Cartmel was talking about, the mask bylaw at the municipal level has limited jurisdiction. Can you remind me of the areas that it is and is not enforceable in?
Thanks, Councillor Hamilton. I'll try to answer your question. So it's enforceable in any public place or public vehicle. So very broad.
But not, for instance, apartment buildings, healthcare facilities, schools.
Oh, my apologies. Where
Yeah.
we have jurisdiction, so we don't have jurisdiction in schools, in hospital settings, or in, sorry, I'm missing the third one here. Give me a minute.
Like apartment buildings or office spaces, for instance?
Private spaces. So childcare facilities was the third, but we just simply don't have the legislative authority to regulate those areas.
Thank you, Councillor Hamilton. I think everyone had a first round. So, Councillor Salvador, if you could take the chair, please.
I have the chair.
Thank you. So, Mr. Corbold, on the mask bylaw that we have in place now, no changes are required. We can carry on with that, right?
I think if we carry on with it right till the end of the month, Your Worship, we will be consistent with the province, with the exception of the age limit. So as we briefed, so the one question I think in front of council is, do you want to constrain the bylaw so it only applies to 12 and up, which is what the province is doing effectively on the 14th, or do you want to continue applying the face covering bylaw for children, essentially?
Yeah. What does that decision require? Do we need to make that decision today, or we can make that decision in the future?
It's up to council. It's not urgent today because the provincial rule doesn't change until the 14th, I believe. So it doesn't need to be. If nothing will change today, if there's no decision made.
Okay, so we will continue to have that bylaw in place, continue to enforce it, whichever capacity we have been doing so.
Correct.
And I hope.
There are two ways to change it. You can ask me to just change it under the exemption I can do, or you can change the entire bylaw.
Yeah, and I don't see any reasons. I haven't heard any strong arguments from council members that we need to change our bylaw. I think seems like a consensus that we should carry on with our bylaw. And if we are challenged by the province, we'll deal with that at that time. But I think we should carry on beyond expiry of the provincial mask bylaw. So that's one. Another one is a very practical concern from a lot of residents that we heard during the protests on the weekend, and mistreatment of those who were wearing a mask in public places. So this would become a public safety concern for a number of Edmontonians who will continue to abide by their personal responsibility of containing the virus, particularly wearing a mask in public places. What authorities do we have as a council to ask police of increased enforcement and being vigilant out there? So I know we cannot direct a chief to do that as individuals, but can we write a letter from council to commission that concerns that we're hearing from citizens and convey those concerns to commission?
Absolutely, you can. But I would also say that we did see some very good enforcement over the weekend, given the complexity and the difficulty. And so I do think it's worth noting that the actions of EPS were very successful in avoiding much other confrontations as well. But yes, you can absolutely write a letter to the commission expressing citizens' concerns that you've heard and asking what more could be done.
Yeah, because those voices, some voices will be emboldened by these changes, particularly those who have never believed in COVID and have been very forceful in expressing their views, and we have seen that in the last couple of weeks. I'm worried about the safety of our public, so I need to figure that out. So I'll think about that, how we deal with that. And we will continue to require our employees to be vaccinated, the policies that we have in place now.
Correct. We have a mandatory vaccination policy that does have a reasonable accommodation to test on a routine basis before showing up for work. And that will remain in place.
So that will continue. And are you going to, I'm pretty sure you're going to monitor the impact of the cancellation of the REP program on our employees' well-being, because if more unvaccinated people are coming to a rec center or other facilities, that will actually could potentially make our employees sick or be infected with this. So are you keeping an eye on managing the workforce and keeping those facilities open?
We are indeed, and the biggest step we could take on that was to institute symptom checking at our facilities, which started this morning and is going well.
Okay. And transit mask bylaw will continue until we lift our own bylaw, right?
Absolutely.
Okay, so this is a level of protection for transit employees, which absolutely should be a worry. On a legal, Ms. Palouf, if we carry on with some of the measures that we have to protect Edmontonians, particularly mask bylaw, and provincial mask bylaw is repealed, and you think our ability to institute, our jurisdictional ability under MGA is strong, that if province does challenge us on that we can defend our right, and we are very strong on that.
That's correct, Mr. Mayor.
Okay, good. I hope we don't go there. I hope province wouldn't go there, but if they do.
And I would just say also, Mayor, we have done that in the past. We have instituted the face covering bylaw without a provincial order doing the same.
Yeah.
We have led on that in the past.
And we will defend our rights whichever way we can. Okay, I am out of time. I will move the second round.
Second.
Let's vote on a second round.
We have all the votes.
Please display the vote. That is carried.
And can you keep the chair as well, Councillor Salvador, for a few minutes? I need to step out for a minute.
Oh, yep, for sure. And we'll get the list of speakers back up, please.
We're just sending it back out.
Sure. Great, and we'll go to Councillor Paquette.
Great. Thank you, Madam Chair. Just a quick question. When we do our checks at our facilities, are we also doing a temperature check when we're talking about symptoms?
I'm going to ask Ms. Poirier to, no, I don't believe we are. Just got the answer. No, we are not doing a temperature check.
There would be a reason we're not.
So at this time, we do not have temperature checking in our process or our procedures. And we understand that the screening process of going through the checklist, we have a list of all of the symptoms at our front desk. The staff that were previously checking for QR codes are now asking people if they have any of the symptoms and then allowing them into the facility.
So we're just relying on self-reporting and no evidence.
Correct. If we did see someone with visible symptoms, coughing, sneezing, runny nose, we would be asking them to leave our facilities. I'll just see if Mr. Jevney or Ms. Norman have anything to add.
No, that's correct. We have never done the temperature checks at any point in our process in any of our pre-screen.
So before the RAP, gave evidence at least of vaccination, but now we will have no evidence. Okay, that's clear to me now. Okay, thank you. Legal question. If we were challenged by the province on an REP program, for example, would that lead to discovery of provincial health data?
I'm not understanding your question.
Well,
Councillor
if they
Paquette.
challenge us on REP, it would probably have something to do with a health challenge as well. So in the process of discovery, would we have access then to their data that informs their decision making so that we can prove that our decision making either is or isn't aligned with actual data?
So you're saying if the province challenges us in a legal setting, is that what you're asking?
Yeah.
Well, you're right. I'm just trying to think of, I suspect that wouldn't be the route that they would go, but you're correct. If
Yeah,
they,
it probably wouldn't be the route they go, but
you're correct, Councillor Paquette. If we did get a legal challenge, we would need to disclose all of our evidence and data and information, and that would be open to discovery.
okay.
Very
Yeah,
high.
we've heard a lot about what's reasonable, but we haven't heard a lot about what's optimum. And we talk about that a lot. We talked about that before. So it may be reasonable to follow some of the moves based on some of the evidence. It's also reasonable to follow other moves based on other evidence. We know that. So the question is optimization. So to administration, I mean, it is sort of a sticky situation, but again, I asked about what we could do to support businesses who want to keep REP. What do we do to support our Edmontonian population that on a majority level seems to want to keep REP, especially seniors who are only going out because of it?
Well, I think the number one thing
How do we support them?
if we decide we want to support those individuals who want to keep REP, I would say we can institute an REP program. The other way we can help businesses who want to keep REP is they can keep doing REP on their own. We have heard from many businesses that there is a cost to doing REP in terms of staff and the people that have to do the checking, much like there is with our staff as well. So potentially there could be an opportunity to provide financial support to businesses who carry on, or
there's a fiscal
incentive.
cost to doing it, but there's also a human cost to not doing it. So, I mean, really, at the end of the day, we got to figure that out. Because I think, Dr. Sikora, this is accurate. New Zealand has experienced under 60 deaths in the entire time of COVID, and we hit that easily within a week. So, I mean, obviously, there's something going on here that has to do with the value of human life. Any thoughts on that?
New Zealand had different measures, and they approached a containment strategy, which...
Okay, so are you saying that their data is incorrect?
Your data is correct. Just the strategies that were undertaken was different in the New Zealand environment.
Yeah, so obviously we don't need to change our masking bylaw. We're good there. The real question is REP and what the city can do. I don't have a motion to put up on that yet because frankly we don't have enough information, but I'd like us to be informed on that a little bit more. And maybe that's the motion, to come back with our options on that. So we'll circle back.
Thank you, Councillor Paquette. I'm going to go to Councillor Wright.
Thank you very much. I just wanted to follow up a little bit on Councillor Cartmell's line of questioning as far as transmission of COVID, especially with those who are asymptomatic. So with the province removing their restriction program, what happens when somebody goes into a restaurant and removes their mask so that they can eat? Does that increase their likelihood of transmission, both to and from?
That could increase their likelihood of transmission to other people, but also could increase their likelihood of acquiring illness as well.
And if we were to institute a vaccine passport so that people could travel freely around Edmonton and frequent those businesses, those restaurants where it was in place, would having that vaccine also reduce their level of transmissibility and being able to contract the virus?
It reduces risks overall, but we have a vaccine coverage that is nearing 90% in our adult population. So it's, are we limiting for 10% the 90%? And to what extent do those other interventions actually play a larger role, including the physical distancing, the environmental cleaning, ventilation, masking, and then the symptom checks? And I think those are still instituted and still in place and still very powerful tools to helping reduce transmission events overall.
I guess my concern is with the symptom checks, if somebody isn't symptomatic, that doesn't do any good, right? And my understanding with Omicron is that, and correct me if I'm wrong, please, but Omicron is less symptomatic, less severe than the other variant?
Fewer symptoms, less severe, more easily transmitted overall. But most of the time, people that have transmitted or people that do transmit are going to have symptoms at some point. So symptom checking is still a very powerful tool.
But they still can still transmit without knowing that they have it, because you said it's a shorter.
That can occur. A lot of this is very uncertain, and there are no absolutes in much of the COVID environment. So it's frustrating. I understand.
Okay, thank you, Dr. Sikora. And Ms. Plouffe, I'm just wondering, so under our MGA, the Provincial Municipal Government Act, we do have the jurisdiction then to pass bylaws, and I'll quote, in the following manners: the safety, health, and welfare of people and the protection of people and property. That's correct? Okay.
Yes, that's correct, Councillor.
Okay, so we've got the, I guess, the duty and responsibility then to protect the health and safety. I just wanted to clarify that because some correspondence that we have been receiving says that municipalities should stay out of it.
Yeah, I mean, I think when you talk about legislated, authority, you have the authority. That's not a question about whether you should or should not, but you have the authority if council proceeds in that direction.
Okay.
Well, we don't have.
And one other legal consideration is you talked about the charter. Have there been any challenges against the provincial or federal government in that respect?
I do not believe there have been, not that I'm aware of. I am aware of one in the province, but I don't have the details of that challenge.
Okay, so less likelihood that it would be brought against us?
It's just starting to move, but I mean, given all of the changes in all of Canada, the fact that I'm aware of one, I mean, that's quite telling.
And what was the result of that one?
It's just started in the courts.
We do have several grievances as well, and we have notices of liability that have been served on myself and other leaders as well for some of the safety protocols we put in place in the city. And I just wanted to say one more thing, Councillor, on the question of authority. Yes, we have the authority. What we lack is our own medical advisors at this level of government, which I think is an important point. Good.
Okay, but if we were challenged, as Ms. Plouffe said earlier to Councillor Paquette, that would allow us the opportunity to obtain that data from the province?
So far they're about split.
Okay. Thank you very much. I'm out of time.
Thank you, Councillor Wright.
And I'll take the chair back.
Great, thanks.
Thank you, Councillor Salvador. So colleagues, we have a number of people who are on the board to questions, and that could be a potential motion. And we are only scheduled here till 12 o'clock, so there are two options that City Clerk has sent to you. One is that we carry on till 3 o'clock today, or that we resume our meeting tomorrow at 1:30 p.m. So please look at that and let us know which approach works, and I'll go to Councillor Tang.
Thank you, Mr. Mayor. So recently there was, news about some of the outbreaks in shelters. And I imagine these kinds of events also have huge impact on staff shortage. This is a similar concern for, schools and daycares. I'm experiencing that currently myself, that there's huge concerns about staff shortage. And I guess I'm just wondering, like, what are the school boards doing? I imagine they're currently under discussions as well. And as this policy was passed without consultation from us, without consultations from other jurisdictions, if we implement the public place mask bylaw and keeping our parameter at 2 years and older, but that doesn't extend into school grounds.
That's correct, Councillor. And I guess the other thing I think is worth mentioning, though, is that it's not an all or nothing. So just because schools can't enforce a mandatory mask requirement, parents and kids can choose to wear masks in the school. Now, I know there's a social dynamic of that, and I understand that completely. Certainly better when it's clear regulation. But we have done some checking with school boards, but again, given the late notice yesterday, we haven't done a good consultation, but we will do that in the coming days.
Okay, great, thank you. I think my colleagues have asked most of my questions. I just have one left. Can you just remind me that in the last couple of years, we had the city mask mandate first, and then the province came on board. Then they took it off over the summertime and came back through the Delta surge. And one of the challenges I certainly heard in the last while, especially when it came to businesses, with only the city mask mandate in place, there's just not a whole lot of power to enforce. So you may have it in place, and they just couldn't really do very much about it if people just continue to choose not to follow those parameters.
Yeah, so Councillor, there is some ability to enforce, and the other thing I have to say is that anytime the City of Edmonton has had a mask or face covering bylaw in place, we have consistently seen a 97%-ish compliance rate. So, big shout out to Edmontonians because they are following the bylaws that we have had in place. The one enforcement measure we lose without the provincial order is the ability for AHS to in fact close premises down. So AHS has in fact enforced the health order and the bylaws related to masking and other things, and they've done it in a very positive way. That would not be done without the provincial health order in place.
Gotcha. Great, thank you. And finally, to Dr. Sikora, I appreciate you being here and providing this voice of expertise. And you have mentioned that the stepwise kind of approach that the province is doing is sound. But would you say that it is sound as long as there's other parameters as sort of like a safeguard at the city level?
I think as outlined, it's a very reasonable approach. I mean, REP first, having served its purpose, is being the first measure to come off, with the assumption and the description that all those other measures are continuing, as described by Mr. Corbould and our administration. The discrepancy of the 2 to 13 year age category is where there is a discrepancy, and perhaps that's up for a broader discussion and perhaps a motion. What the city decides to do with that, I think, is going to be a very important thing. And one of the things that's important to balance is safe spaces and transit as being a resource for our entire population could be one of those measures to really strongly consider.
Yeah, I think I'm just worried about if we can go in certain directions, but it's inconsistent. Kind of in other spaces, we are not necessarily following some of the principles and values that we're laying out here. But anyways, thank you all very much for being here and answering questions. That's it for me.
Thank you, Councillor Tang, and I will really encourage council members to maybe start focusing questions on what steps we can take or should not take. Then we can actually bring their focus to the discussion, keeping the limited amount of time that we have and the agenda that we have to conclude.
And if I
Yeah.
could, Your Worship,
Yeah.
Dr. Sikora is not available this afternoon or tomorrow. He's got 12 or 13 other municipalities that he's having similar conversations with.
Yeah.
So just wanted to point that out in terms of
Absolutely.
if you have an urgent question for the doctor, it would be good to do that this morning.
Yeah, please. So I would encourage that. So please, Councillor Stevenson.
Mr. Mayor, just to let you know, I think we are developing a pretty straightforward, simple motion so that we can focus conversation.
We don't have a motion on the floor yet, right? So I don't.
Not yet. I'll wait my turn.
Yeah, it's going to be quite a while before you have that chance, Councillor.
Yeah.
Councillor Paquette. Okay, Councillor Stevenson.
Thank you. I'll just really focus in on a question, Dr. Sikora. I've heard that there's opportunity with screening to prevent symptomatic folks from entering the spaces. But again, I understand that the purpose of REP was to increase vaccination rates. I'm unclear why we're not seeing that in relation to the booster shots and the role that the REP could play in increasing those numbers, which are low right now.
I think that's a good question. If the REP would have to be consistently designed around what is appropriate, or what's deemed up to date or adequately protected at a particular point in time, and it would be an ever-evolving situation for implementation. It does get technically difficult, and I'm sure that was part of the discussion at Cabinet and at Alberta Health and had informed decision makers on. Again, I'm just speaking around generalities, so it would be possible, albeit difficult and very specific for an individual.
Sure. And any reasoning why that approach hasn't been taken?
Again, I'm not sure what discussions had been undertaken at that table.
Okay. And Mr. Corbell, just wondering, from your note, like I'm just thinking of the QR code. I know that folks will be able to continue to be able to download their vaccination records, which I believe would indicate if there had been a third dose given. Is your understanding that there's opportunity within the scanner reader to share that information?
I don't know. I'd have to check on the specifics of doses. All I know right now is they look for the basic dose and give you a green or a red based on that. So I don't know the answer. I don't know if Ms. Poirier is aware of that. We might have to go back and check, but we can do that.
Okay, I'm mindful of time, so I'll leave it there and yield the rest of my time. Thank you for the answers.
Thank you, Councillor Stevenson. Councillor Knack.
Sorry, Mr. Mayor, I meant to delete myself. Knowing there's a motion coming up, I'll wait for that. Thank you.
Okay.
Sorry, and I do have an answer now to the last question. So in order to be cleared through the app, you need 2 doses, 1 and 2. That's what clears you, but there is no checking of the booster.
Okay. Thank you. Councillor Rutherford.
Yes, thank you. I'm mindful of time too, but I think again, I'd like to bring up some pieces that I haven't heard discussed in the context of this conversation thus far. And one of them is around, one thing we haven't talked about in this public health discussion is sort of, sometimes viruses have impacts that show up later in life. Like I think about shingles, right? With like shingles is an example, right? Where the virus kind of lays dormant in your body and then down the road, it emerges. There's also long COVID that the studies are just coming out on the impacts of that. Let alone, we have talked about the deaths and the number in ICU, but those are 2 things that we haven't talked about. Dr. Sikora, can you talk about what we do know and what we don't know about those 2 areas?
So we have a very, very robust long COVID working group and supported by our strategic clinical networks of neuro rehab. So we are working with primary care, specialty care across the infrastructure to be able to better enable our primary care physicians and specialists to support individuals in their medical home who might have long COVID. The best or the estimates for what percentage of individuals progress to long COVID is variable. It can be somewhere between 5 and 15% with that that ongoing fatigue, tiredness, and lethargy. We are working very actively with our rehab groups to be able to support our population in this post-COVID environment. So within our healthcare infrastructure, we are looking forward. We're much more forward-looking around what our future looks like, and post-COVID is going to be one of those realities that we'll have to contend with.
So what about the any research or kind of discussion in the medical field around any, because again, I know this is a novel virus, so we don't know what's going to show up, but is there any research or any conversation in the medical field about that?
So once you clear COVID, it being a respiratory virus and a respiratory pathogen, it doesn't affect your lungs or affect your respiratory tract overall. Once you clear it, and if you're successful in surviving, you do retain some immunity. Immunity due to vaccine is arguably better. But once you clear the virus, and it doesn't reside with you. But you do and may retain some susceptibility and likelihood of being further infected into the future by.
Yeah, I'm not talking about infection rates, though. I'm talking about, so the virus leaves your body completely. It doesn't lay dormant, like with the example I gave of shingles.
Yeah, so it does not lay dormant in your body.
So we do know like reasonably well that there's not those long-term, like a new thing emerging, 30 to 40 years down the road in our population.
Should not. I mean, we do have experience with other SARS-like viruses, so that there is a body of literature on this over the past 20 to 40 years.
Okay, great. That was the only question I had that hasn't been covered, and in the context I wanted to get some information on from a public health perspective. So I appreciate that. And I just want to circle back to one other thing though. Does the school still in schools, I know this isn't our jurisdiction, but it's important to the context of the mask bylaw discussion. They still have exempted schools from that from requiring social distancing because class sizes are too big to actually effectively social distance. So you mentioned in the last one that that's a health measure that's still in place in schools, but is it?
I believe Councillor Rutherford, and I'm going to confirm that information, that the immediate removal of the mask piece is separate from the other health measures that I think will come in a future step. But I'm going to confirm that for you. Is that what you're asking?
I'm asking because last year the government exempted schools from having to socially distance. They have the cohort system and they have those things, but they exempted schools from being required to socially distance.
Yeah, I've just confirmed, Councillor Rutherford, that the all remaining provincial school requirements, including cohorting, will be removed in the next step in and around.
They're not required as of today to socially distance. And so as of the 14th.
Sorry, go ahead.
So as of the 14th, they will be able to choose to or not be required to wear masks and not be required to socially distance.
The mask piece comes in force on the 14th. All other measures, March 1st.
But can I get clarity then? I know I'm over time, but can I get clarity on whether because this province has changed these legislations so frequently, it's hard to keep up.
Yeah.
Let's be honest. And the last I understood as a parent of children in elementary is that they couldn't have, they exempt schools from the requirement to socially distance because of the cohorting.
Yeah, so we'll.
Correct. And that was the justification.
Sorry, Councillor Rutherford, way out of time. I appreciate that. And we'll get to, hopefully get to that answer, that clarification as we get into other questions. Okay, thanks. Councillor Cartmel.
Thank you. I guess to Ms. Plouffe, much earlier today we heard that if council puts in some measures that those could be overturned by provincial legislation. They would do something to alter the MGA, is my understanding. Could that also be done by an order in council, or does it require, does it require a vote in the ledge, or could an order of council override any decisions that we make?
I'm going to confirm that, Councillor. I do not think they can change the legislation on that without, by an order in council.
Yeah.
But I will confirm that for you. I don't know the answer.
And I concur with that. I think they would actually have to change the legislation. You have to table it in the Legislative Assembly, and that would take some time to do. I also don't believe that they would try to do that.
Okay, thank you. That's all I have.
Thank you, Councillor Cartmel. Councillor Rice.
Thank you, Mr. Chair. My first question is about our guiding principle and for us to make a decision. I understand we have the motion to vote and on floor. The first question is about the GPA. GPA is important to ensure inclusion and equity. And then as Councillor Hamilton mentioned, and it's very difficult discussion, and we heard so many different voices and from residents, from Edmontonians and across the world. And is there any specific guideline how we balance the voice we heard and for the decision we're going to make to ensure this inclusion and equity? And because I only saw this one sentence.
Yes, that is a very tough question to answer, and it gets back to the point that we found out about this at 5 p.m. last night, and we haven't had time to do a full GBA plus analysis, so we will do as much of that as we can, Councillor, and especially depending on if there's a motion that directs more work. We have not done a full GBA plus analysis on this consideration, given that the late notice we had to work on this.
Thank you for that clarification. This is very important. I just want to challenge my own thinking as well. And then we sitting in this chair, and it is not my self decision. Is actually my constituents' decisions. So I would like their voice to be heard and fully, whatever their voice are. So that's his first question. The second question.
Sorry, if I could, I would say that while we haven't got specific data, when we think about servers in restaurants, low-income wage earners, people in the front lines of this work, we do think about young women, racialized people who are in those jobs. I just don't have specific data to provide council today on how many different folks of different backgrounds and cultural and the full gender GBA plus numbers to share, and I don't think we could do that in a timely manner.
Okay, so next question is about the business. I noticed the option and for council's considerations, or one option is maintain the vaccine and negative test requirements for all REB eligible business in Edmonton. I just want to understand that how this could impact our economy recovery if we apply this. And then I don't have answer for that, but I really want to get some more information on this business supports perspective, and because due to the COVID-19 and the business is already suffering, and if we are continue to maintain this vaccine passport and the test requirements for our EB eligible business in Edmonton, so what does that specific message we want to send to all the business? And then that is my question. I know maybe it's not an easy question to answer, but when we make certain decision and then we talk about economy recovery, and then this could be consideration and in our decision-making process.
Yeah, I think you're right. It needs to be a consideration, but again, it's very difficult for us to share data. I think we're going to get more data as we go along here, but I think you could see, for example, with the removal of the REP program, a temporary loss of revenue in businesses because people won't feel as comfortable going to businesses if they don't know others around them are vaccinated. How that's going to change over time, we'll have to collaborate and continue to work with the business community to get those stats.
I already received several emails already, and then talking about the move out the business out of our city. I think yes, and then there's certain voice there and a certain concern there, but it depends on our city when we make this decision and how we can, in the best interest to keep our public health, to protect our public health at the same time, and then to look at the big picture and not only from one angle. So this is why specifically during this option. So the option when you list here 1, 2, 3, 4 is the slide 13. So is all together in the one motion or is it separate in the motion?
That would depend on the will of council and whoever wants to put a motion together. What we tried to do is provide council with a menu of all the potential things you could do. Let this discussion happen. And so we're not proposing a motion. We're suggesting that council may want to, based on those menu of things you could do, decide which ones you want to put in a motion.
Okay.
Thank you.
Thank you. My
Thank
time is
you.
up.
Thank you, Councillor Rice. And I'll go to Councillor Paquette. And in the meantime, if Ms. Palouf, if you have the answers to Councillor Rutherford's question, if you could intersect that somewhere in that conversation, would appreciate that. It's a very important question. Councillor Paquette.
Okay, I would just note that I would be on my third round. Councillor Hamilton is on her second.
Oh, yes, you're on third. You're going third round. Okay, got it. So, Councillor Hamilton, you go first.
Hi. So one of the things that I'm noting in the, I'm just trying to wrap my governance brain around this, which is the provincial restrictions repealed this morning at midnight. And I feel like we are trying to circle around an action, even if, and I'm going to put a pin in the mask question because I think we have a few weeks to sort that out. Even if we were to change the REP program, we would likely have to give businesses quite a bit of notice, would we not?
Yes.
Mr. Corbould?
Yes, Councillor, I think it's a great point because I wouldn't want the city to do what happened to us yesterday in terms of getting no notice to implement something. And so I think we should spend some time, and I think we should give notice some time to, give businesses some time to adjust if we're going to change the rules. Yes, so I'm sensing there's some urgency, I think, in our own scheduling to try and resolve this question sort of ASAP, but I'm not actually sure if that's a good governance move for us because I'm hearing a lot of questions. My concern is that we will today and tomorrow make a sort of that if there is a change, we invoke a change that will require much more notice to businesses, and I guess I'm kind of struggling with the urgency I'm sensing and a need for longer timelines. And I understand this is a position we've been put in, but it is nonetheless one we were in. And so maybe I'm maybe struggling for some guidance on how to proceed. Like if there was a question or movement around the REP program, what would be the earliest that we should, like what kind of lead time should we give businesses? Councillor, I would say that the urgency to make a decision one way or the other is there. So the sooner that can be made, I think that would be a pressing point for council to consider if you want to decide to make a change. Once we get to that point, if there is a desire and direction to do the change, it's a bit interesting predicament we're in because if we carry on rep, the easiest thing to do is tell everybody just carry on what you're doing yesterday. But the more days that they go without instituting rep, the more change it is for them. So, you know, I want to say it'd be nice to give them at least a week's notice, but given the circumstance we're in, it could be even more difficult because they were doing it yesterday. Now they're not doing it. If we give them a week's notice, they get people used to not doing it. So it's a very difficult position that council's in, quite frankly. And so we can certainly reach out to the business community and get a perspective on notice and bring that back to council.
Okay, because and I feel like that's a piece that's missing here. But again, that complexity between being consultative, yeah, I don't. We're in a tough position. I'm just also mindful of how much time we could spend on these questions, given that we still have to complete our agenda. So
Yeah, the other
yeah.
concern I have is I can't bring you much more data to support a decision. And what we have in front of you, I might be able to answer some specific questions, but I'm not going to be able to bring a bunch more ton of medical or health data for you to make a decision.
But one of the options available to us is that we could call us, and I'm going to hear some bristling when I say this. If we get alternative feedback, we can call a special council meeting with 24 hours notice, correct?
Absolutely, if that's the will of council.
Yeah, so there's no recommendation here. We could receive this report for information. We could think on it and potentially call a special council meeting on short notice if we deem that the REP program might be necessary.
Correct.
Okay, all right, thank you for that.
Thank you, Councillor Hamilton. I just have a quick question. I'll wait. I'll move. Could somebody move the third round, please, for Councillor Paquette?
I'll move third round.
Second.
Second.
Please vote. Yes. I don't know, some reason my
That's
system.
okay. We've got you, Mr. Mayor. We got all the votes.
Display the votes, please. That is carried. And I'll go to Councillor Paquette next.
Thank you, Mr. Mayor. I promise that Councillor Hamilton and I have not been talking about this. It's just uncanny. Okay, so I would like to make the following motion, Mr. Mayor, that one, that administration return to council as soon as possible with options for and detailing the potential implications of implementing a municipal REP, including options for both city-owned and operated facilities and citywide private businesses. And two, and this is actually courtesy of Councillor Knack, that the mayor, on behalf of council, formally requests that the provincial government provide administration and council with the recommendations made by the Chief Medical Officer of Health and the data used to make these recommendations to help inform that discussion. And just to quickly introduce it, I think this.
Can we get a seconder before you introduce it, please?
Yeah, sorry.
Second, Jans.
So moved by Councillor Paquette, second by Councillor Jans.
Yeah, and to quickly introduce it, I think this answers Councillor Hamilton's concerns, which I share. And I think it moves us a little bit forward with understanding the options that administration put forward in the presentation. We can flesh that out a little bit and see where that leads. And the addition of item number 2 may actually be, we may get the information, we may not, but I think it would be instrumental in helping shape much more robust and acceptable and understandable policy for the public. And certainly would make decision makers' jobs much, much easier. But otherwise, I think that this motion addresses the questions that we've been hearing from Edmontonians, from communities, and addresses some of the concerns around equity and evidence. And so I hope you get support, and that's my introduction. Thank you.
Thank you, Councillor Paquette. I just need one clarification on the second part. Are we requesting that information from the Chief Medical Officer to inform our decision in part 1? Because if that is the case, then I don't think we'll get the information in a timely fashion for us to make the decision.
Maybe we can add in general, if someone wants to add that, that's friendly to me at the end of that sentence, because it's not specific to part 1, but it is a general.
Yeah, okay. Because otherwise we'll be waiting quite a while for to act on number 1.
We may be, but it never hurts to ask.
Yeah, of course. I think we should be asking for that, absolutely. It's very important information on which we can make an informed decision. So, Councillor Wright.
Hi, I'm just wondering if we could do a friendly amendment to that. Instead of as soon as possible, could we say 3 o'clock tomorrow afternoon so we can extend orders to that time for this council meeting? Or as Councillor Hamilton suggested, do we need to have a special meeting?
Is that a question to the mover?
Yes.
Okay, the reason I put as soon as possible is because I don't know when administration could actually put that together in a meaningful way for council. So if it's okay, I'm going to defer that to administration, understanding that we may need to have a special meeting.
Given what we need to do, our estimate is we need 2 days to put this together based on, because it would require a draft bylaw and some other work and not a full consultation, but some questions to business and impacts and other folks.
So that would put us till Friday afternoon then, is that right?
Correct. And that'll be tight, but we can try that. Yeah.
So then I guess to the mover, is that a friendly amendment or would you rather wait until?
So just for clarity, Councillor, there's a process for calling a special council meeting. So before you can actually refer a motion to the meeting itself actually needs to exist.
Okay, so I guess my question is to the mover about specifying a time rather than just saying as soon as possible.
Yeah, and that can we as soon as it sounds like we have sort of a timeline in mind now, so I'm open to friendly amendments on that.
Okay, well, so that would be my suggestion and would be, I guess, Friday, so.
So
and then beyond that, as far as a special meeting, I guess that'll be something else to be determined. Thank you.
Madam Clerk, you were going to say something?
So just if I can understand, so, and on administration, Mr. Corbould will need to correct me, assuming that the information can be ready in 2 business days, it may not be ready for council to review. It would have to be a verbal walk-on report. And I'm not sure if council's even available. I'm having a hard time getting consensus on when council can even finish today's council
I think having
meeting,
a specific date may pose challenges. So
Yes.
having as soon as possible give you more flexibility to find a time and date.
Yeah. And if we could deal with the question of continuing this meeting before we start scheduling more meetings from an agenda perspective, that might be most helpful.
Okay. So I think keep it as soon as possible. That's the nod I'm getting from admin as well. I hope you're okay with that, Councillor Wright. Just gives us more flexibility.
If it's not possible sooner, then keep it the way it is.
Good. Councillor Rutherford.
Thank you, Mr. Mayor. My question is to the mover. Is there a reason that you didn't want administration to also explore that symptom assessments such as, fever checking and those kind of things as also an option on the table for that report back?
Councillor Paquette, as a mover.
Sorry, I didn't know that was to me. Can you clarify?
So the question I asked was, was there a reason why that report back didn't include also administration exploring the same pros and cons with some sort of symptom assessment, like fever monitoring?
I see. That is a good point. My focus was definitely on the REP and not what we're currently doing. I think I'm open for that to being a part 3 or its own motion. I didn't think to include it.
Yeah, and I got into this questions to administration because my understanding is that really what we're doing right now is a self-reporting, like, have you been out of the country? That's that simple checklist. So it's really on the honor system. And I know that there's challenges with anything, but we're not at this point doing any kind of temperature checks or requiring any kind of temperature checks.
We are not, Councillor, and we can look into that. I can tell you right off the bat, there will be some serious privacy issues, because there's a difference between asking somebody and sort of going up to, somebody's forehead and actually taking their temperature, which is their private information. So we'll have to, we have to
So there would be
that.
more privacy issues with taking a temperature check than having them scan a QR code.
I'm not suggesting that. I just don't know.
Just
And
want to
and
clarify.
we have to, I'm not giving you a clarity on that. I have to check and provide advice back to council on that.
That's why I was saying that for me, my preference would be that would be
Yeah.
included in this motion, even if it is a part 3 then.
So just to, it may be cleaner and make more sense if it's its own motion. As then we start getting sort of a jumble of ideas in one motion, and I know administration prefers to keep these things as separate as possible.
And I might ask, Councillor, if we could let Ms. Taylor talk about the fever piece, because she has looked at that a bit from, especially in young children. So, Ms. Taylor, could you comment on that?
Yes, so Dr. Sikora may also want to weigh in here, but definitely with Omicron, fever is more prevalent in under 18. And I will note from an employee perspective, we would need to build out the SOPs appropriate for having our individuals take temperatures. So that's not something that we could implement immediately. And Dr. Sikora, I don't know if you want to add whether or not AHS is still doing that in their facilities.
I don't believe we are doing this in our facilities, and I don't believe it's being done in many of our long-term care facilities overall. Implementation of temperature monitoring is fraught with a large number of operational challenges. Training, maintenance, upkeep, validation, calibration are all important factors to consider. So it's a time and costly intervention overall.
Okay, no, that answers my questions for right now. I'll leave it as is. Thank you so much.
Thank you. We are at 12 o'clock. Would somebody move that we finish this item?
So moved.
Second.
Salvador, seconded by, I'm sorry, Councillor Cartmel?
Yes.
Okay, thank you, Councillor Cartmel. Please vote. Yes, Madam Clerk.
Yeah, so we're going to send it. So just for clarity, we need to finish this item and we require instructions on what to do with the remaining items.
Yes, yeah.
Thank you. Yeah, we're just sending it out. Got a verbal yes for the mayor. Councillor Briquette? We've got all the votes, Mr. Mayor.
Display the votes, please. That is carried. Okay, now back to the list, and was Councillor, I just lost that. Okay, here you go. Councillor Knack.
No, I was on for the schedule piece, so I'm good. Thank you, Mr. Mayor.
Thank you. Councillor Rice.
Two questions to mover and administration. The first one, Madam Clerk, can I have the motion on my screen for the wording?
Yeah, it is, and it's also in eScribe, but yeah, we'll happily put that back on the screen for you.
Okay, thank you. I really appreciate administration provided very good reports today, and then including all the options they think could put in front of us and for discussion. And for that purpose, I'm looking at this motion part 1 to Councillor Paquette. Is that better and for administration not in like for this motion not include the second part, like detailing the implications of implementing municipal REP. I think because there's so many options and administration from their end they could provide it. If we only focus on this, and that means we exclude out some other options. So I just friendly to ask you if you could make that amendment.
Okay, so if I'm understanding you correctly, you would like part 2 removed? We can split it.
No, the part 1, for part 1, my amendment I could suggest is not include detailing the implication of implementing the municipal RESP. And because that's actually limited the option for administration could provide to us. And there are so many options, and even by looking at the reports they provided to us. And I think keep that high level, and this one could be one option they will provide it, but they can provide all the possible options they could bring us and for discussion and for decision as well.
I hear what you're saying. I think that the detailing the implications might be important for council to be able to weigh, because there's probably a lot of legal considerations as well as maybe in the next day or two some input from businesses. So it might be important to retain that part, but I do hear what you're saying, for sure.
And from administration's perspective, I would just say that we tried to outline all of your options today in the presentation, and hoping that we could focus on some and not do all the work on all those options. But it's the will of council. Certainly, having focus on one option helps us to bring that information back in a more timely manner. If you want us to do all the options, it'll take a little longer, I would suggest.
Yeah. And I would suggest,
I would just add that what this helps us to do is to start focusing on a solution. Now that we've got the options administration provided, now we can sort of unpack what that means, and if it's something that council would like to move forward on.
Okay. And then, so I just want to bring that thought up, and then to address some of the options and may not included here. So if you think that will provide the option and from time sensitivity, and then you want to keep this way, and I'm okay for that. And the second one is about to mover. And so is that possible we just divided this to not as a part two? And because I heard the concern about we may not get the data and the info, we just put them together and to respond to the part one. And then we can divide this to motion.
Yeah. I think it can stay as one motion. We can split it and vote on item 1 and item 2. I would say that number 2, it doesn't hurt to ask. I mean, we could always FOIP the information, but that's sort of a blunt tool when we could maybe just start with the idea of collaboration.
Okay, so if we can vote part 1, part 2 separately, that's okay. Okay, thank you.
That's not up to me though.
Yeah, we can.
Yeah,
we
so can we confirm if we can vote this separately?
Yeah, we can always split the motion, Councillor Rice, into 2 parts for voting purposes, right, Madam Clerk? Madam Clerk, we can split the vote in 2 parts for voting purposes?
Yeah, if that's the will of council, for sure.
Got it. Okay, good. Okay. Thank you, Councillor Rice. We'll do that. Councillor Stevenson?
Okay, thank you.
Thanks, Mr. Mayor. I'm going back to Councillor Hamilton's comments about the importance of providing clarity, and I'm just worried about any time lag that we're providing in terms of the uncertainty that the next few days and potentially week will bring. I think, Mr. Corbell, you put that really well in terms of currently there are behavioral expectations about showing QR codes. If that's suspended for even a few days, that again just creates more uncertainty, I think creates more impact on the front line. So just wondering if you could speak to what it would look like if we just provided direction for one of the options today rather than asking for a report back.
If it's an option that would require a bylaw, we would have to bring the bylaw back, I think is the piece. If it's carry on with what we're doing for face masking, that doesn't for face coverings, that doesn't require a bylaw change. So it's dependent on if it would require a bylaw that council would have to approve.
So then in terms of what's currently requested by the motion that you would come back with options, would that mean that you would be coming back with the draft bylaw for us to approve then, or would that be another go back and
No, our concept and the reason we wanted 2 days is specifically so that we could provide you with an option and we could give you a draft bylaw at the same time for consideration. It would probably be in 2 separate reports, but that is one of the main reasons we need 2 days, is because we've got to do a lot of legal work to get a bylaw right. We have in the past a couple of times tried to write some bylaws on the fly that have always had to been fixed after. So our preference is that we do some good due diligence, but we would come back with a bylaw ready to go.
Okay, I appreciate that. So just from my understanding, if we gave you that direction today, there's still the lag of needing to draft a bylaw and have that passed, but that you will be coming back with the bylaws so that if we do approve one of the options, it's ready to go right then.
Correct, and we'd also come back with advice on how much time you want to give people to get ready for the change.
Or continuation of status quo, depending on how you look at it. Okay, great.
I'll just interject, Councillor Stevenson, if you wanted to add, including a draft bylaw, I would find that friendly.
Sure, if that provides clarity. I mean, I think, sure, let's add, going with the principle of clarity, if we could add that in, that would be most welcome. Thanks, Councillor Paquette. Mr. Corbold, I've also heard mention of reaching out to business. I'm wondering what other outreach might be possible or feasible just with the general public to hear from Edmontonians. I mean, I know we have the Insight Survey, which is a very select small group, but just wanting to recognize that the businesses aren't necessarily our only, the only constituency that we need to be checking in with.
I'm going to see if Ms. Owen can respond to that.
I can definitely get an answer on how quickly a research survey can be assembled and collated. My early sense is that would not give you data by Friday, but let me get specifics on timing for reaching out to that 14,000 person community.
Great, thank you. I really appreciate the constraints here, and the business community is absolutely essential to be connecting with. I don't want to lose the really important feedback that many Edmontonians will have to share. I'm also wondering too if this work can explicitly include consideration in terms of coming up with the details of the implementation if the QR code reader is disabled. And also options, if we're not using the QR code reader, if, electronic public health records showing a third booster status can also be a consideration.
They can all be considerations, and we'll be able to provide that when we come back.
Great. I think that was everything that I had. Thank you. I recognize we're asking you to move mountains in a very short period of time, but I think it's essential that we're providing clarity and leadership for Edmontonians at this time. Thank you.
Thank you, Councillor Stevenson. Councillor Cartmel.
Thank you. I am wondering about the active screening option here, that if there's, would there need to be work done to stand up something that says we have an active screening regulation or requirement in publicly accessible spaces as opposed to an REP program? Would that be covered under options, Mr. Corbold?
Right now, we don't need anything to do it in our own facilities. If we want to make that law within private facilities like bars and restaurants, that would require a bylaw, and we would have to investigate that. But for our facilities, we're essentially relying on our OH&S responsibilities and we've already implemented that starting this morning. So it depends on if you want to reach beyond City of Edmonton facilities or not.
So I guess to the mover, would it be friendly to add and or an active screening requirement?
Yeah, I think that's entirely friendly. The one caution, and maybe this doesn't even overlap, but my one caution would be where, actually, it's fine. It's fine.
So I'm going to suggest that we insert the words and or an active screening program after REP in the motion as presented. And then at least we have administration's feedback on sort of those two options. And that gives us do nothing, do this, or do that. Is that fair to the mover?
Yeah, that's fair to me. I'm thinking about how this is perceived by the public, and I just want the public to be assured that we're not going to be asking anyone for the private medical records, even though that's not what you're implying in any way. But and can easily be misconstrued. So let's
Right.
just keep
No,
that
I'm
clear. Yeah.
I'm speaking, as we've discussed today, essentially a symptoms check.
Yeah.
Mr. Mayor, can we just get clarification if that's acceptable to all of council, or if that is a friendly motion or amendment or an actual amendment, please?
I think it's Councillor Paquette is nodding his head that he considers this a friendly, so I don't
Yeah,
know if
it's up to the assembly
the
and not
minimum
the
that
mover.
because I'm hearing nodding heads. With the people I see, they're nodding heads. And I don't see everyone.
Point of order, Mr. Mayor.
Can you just give me 1 second, Councillor Rice? So Councillor Rice has a point of order, so I go to her now.
Yes, please.
Go, Councillor Rice, go ahead.
Mr. Madam Clerk's question, I think the amendment is actually already including the options 4. And if you look at all the pages and administration provided to these already including there. And then we don't need to be that specific and in the motion in the part 1.
Okay. So you're objecting to the friendly, Councillor Rice? Okay.
Yeah, I think the option that administration provided today is very detailed. And then we just need the implication. I agree. Implication is how if we implement those options. I think that would be great to reflect in the motion.
Okay, then, Mayor Sohi, given that feedback, I'm making a formal amendment to this motion.
Okay. All right. So can you please read that into the motion?
Second.
That we add the words and/or a active screening program right after bracket REP bracket.
Yeah. So we are including active screening program, and that's the amendment. So please, we are on the amendment now. Any concerns on the amendment? Please vote on the amendment.
We're just going to take a few seconds and Rama's going to load it into the system.
Sorry, I was trying to speak to it, Mr. Chair.
Okay, so we'll pause the vote. Thank you, Chair.
Okay, so there is list of people. I'll just follow the Councillor Principe. You want to speak to this as well, to the Councillor Cartmel's amendment, or?
Yeah. Yes, I do. I just wanted to kind of get clarification as to exactly what active screening program is. Will it be someone actually screening and asking the questions of each person, or will it just be a sign on the door saying you are legally not allowed to enter if you have symptoms and such?
I think we're being asked to bring back that recommendation, what it looked like. I don't know what it looked like today. Right now, I can get Ms. Poirier to confirm what we're doing as of this morning in our facilities.
So we're being very clear that this is not screening for vaccination status. This is screening for symptoms. And so I think the word symptom is really important to include in there. Currently, there's a sign in our recreation facilities. Our staff who previously were screening for vaccine status are now asking people if they have any of the symptoms that are listed on the board. And if they indicate no, then they are allowing them to pass into the facility. That's the current process today.
Okay, so my question still is, if private businesses, if we are going to be bringing forth a motion for active screening program, again, this is for private, not so much for city, will they be required to ask each individual person the screening questions, symptoms and such? Or will they be able to just put a sign on the door saying, you are not legally allowed to enter this premise if you have symptoms?
Yeah, the answer to that question, Councillor, is that would be the will of council. We'll bring you back an option that provides that and probably provides those different options, and you would have to tell us what you want.
That's great. Okay, great. Thank you.
Thank you, Councillor Principe. Councillor Jans to speak.
Thank you, Mr. Mayor. I actually believe this may be out of order. By looking at the intent of the motion, it's talking about doing an REP. When I see the word or an active screening program, that seems to contradict the intent of the motion. I'm worried about undermining the. I hear direction from the mover and from the debate that the intent is clearly to establish a municipal REP and to have options accordingly. When I worry it should be the wording should be something more like and an active screening program or an additional something like that. That's more doesn't seem to offer a choice against the REP, which is the intent of the motion. So
Does the amendment cancel the intent of the original motion, Madam Clerk?
Well, it is a little odd, and I do think getting some clarity on whether it's supposed to replace the REP program or whether it's actually to provide additional options would be really helpful.
My understanding from Councillor Cartmell's questions were this is additional, does not replace the REP program. Councillor Cartmell, you want to clarify that?
Well, I think by using the phrase and/or allows it to be additive or not. And that's, and the intent is that administration can provide their input and analysis of what an active, and perhaps it should say active symptom screening program, but what an active symptom screening program would be, including answers to the questions like Councillor Principe has just proposed.
Good. So I'll rule that it is in order. And we go to vote. Madam Clerk?
Yep, sure. If you'd like to call the vote, we'll get it up on the screen.
Okay. So we are voting on the amendment of Councillor Cartmell.
We're just waiting for Councillor Rice, please. Yeah, we have all the votes.
Display the votes, please. That is carried, and we're back to our original motion. Any questions on the original motion? I don't see the list here.
We're just getting that back up. 'Cause
Okay,
we
no
need to,
problem, no
we
problem.
need to adjust the main motion as amended. So just one moment, please.
Mr. Mayor, can we perhaps clarify what I'm hearing potentially are 3 draft bylaws? One with a form of REP program at the city, one for an active screening program at the city, and one for both. Am I getting that correct?
So what would be the third one? Sorry, I understand the REP 1 bylaw is required. For active screening bylaw is required as well?
That's what I'm asking. So I think what I'm hearing potentially are 3 different bylaws. One that has REP, one that has both REP and active screening, and one just active screening.
No, and I can answer that. It would be 2 bylaws, and whether council approves one or both is up to council.
So bring 2 separate ones?
That's what we would propose to bring forward.
Got it. That'll be more clear and easy to understand. Okay. All right. So I see no one on the board to speak or to question. So please vote on the amendment.
No, we're voting on the main motion as amended.
Sorry, vote on the main motion, but we need to divide it into 2 parts. So vote on part 1, please, first.
Yeah, Rama's just splitting them for voting
No
purposes,
problem.
and she's going to send it right out.
Rama is doing great. Thank you, Rama. Here we go. We're voting on number 1 first now. Please vote.
Councillor Paquette?
Just waiting for it to come in. I'm a yes.
Thank you. We have all the votes.
Display the votes, please. That is carried. Now vote on number 2, please.
Councillor Rice? We have all the votes.
Display the votes, please. That is carried. And as a chair, I will humbly request to all council members that we have items to finish, and we have deferred some items from today's meeting or this meeting to the next meeting. Agenda is very packed on that meeting as well, that we work through lunch and I finish the items remaining on the agenda until we are done today. Otherwise, we will not be able to catch up and understand this was an emergent item that we need to deal with. I'm glad that we have dealt with it, but we need to also deal with the balance of the two items we have, right, Madam Clerk? One is what items can you let us know that we have?
Yeah, absolutely. Thank you, Mr. Mayor. So council still has to finish or could finish item 6.8, which is the sale of Greenfield Residential.
Yeah.
It also has item 6.2 left to be dealt with. And just a friendly reminder, at ARC yesterday, ARC canceled the non-regular on February 24th, and we've been asked to change orders of the day for February 22nd to run all day 22nd and all day 24th as well. So
Okay.
if we could get a motion without customary notice to manage that calendar change.
So we can do that at the end of the,
Yes, so technically you extended orders to deal with that item. So now if you'd like to extend orders to finish your agenda, that would be helpful.
yeah, can someone move that we extend the order of the day to finish the agenda, please?
So moved, Jans.
Councillor Jans, please, seconded by
Second.
Councillor Rutherford. Please vote.
Mr. Mayor, may we call a brief recess after the vote for a washroom break before we continue?
I think we can take that break as we work through the process. Wouldn't be, because we're all working from majority, well, I would prefer that. Councillor Jans, just quick
Okay,
break.
never mind.
Yeah.
We could actually use a 5 minutes here. 'Cause
Oh,
my
of course,
colleagues to the
council
left
members,
can't leave.
sorry, right, oh my
Wait,
God.
sorry, can,
Sorry, can you vote, the board has carried, and as we set the agenda, we can recess for 5 minutes. Okay, is that okay? We need a motion to recess for 5 minutes, or
With unanimous consent. we're fine.
unanimous consent? I see now heads nodding, 5 minutes break. Wright,
I'm here.
Councillor Knack,
Good afternoon.
Councillor Principe,
Here.
Councillor Stevenson,
Good afternoon.
Councillor Paquette,
Here I am.
Councillor Tang,
Hello.
Councillor Hamilton,
Present.
Councillor Rutherford, Councillor Salvador,
Hello.
Councillor Cartmel,
Hello.
Councillor Rice,
Here.
Councillor Jans, Councillor Jans, Councillor Rutherford. Okay. All right. We are going to go back to the item 6.8, which is the sale of Greenfield residential enterprise land development history. Motion was moved. It is on the floor, and members of council were speaking to that motion, and I will follow that order. And Council Salvador, you are the next on that list to speak.
Sure. Thank you, Mr. Mayor. So yeah, just to speak to this, I will be supporting Councillor Jans's motion. I don't find the arguments from industry members a really compelling reason to stray from the original recommendation of administration to hold Astor, Shaughnessy, and Goodrich. A substantial amount of financial analysis was provided by PwC and Ernst & Young, which both clearly demonstrate that retaining Astor, Shaughnessy, and Goodrich provide the greatest return for Edmontonians in the long run. And I understand there have been arguments made that the numbers provided were incorrect, but for me, that doesn't really square with the considerable interest from industry to acquire these lands. In this case, I really do consider groups like PwC and Ernst & Young to be much more impartial advisors. And at the end of the day, they're motivated by their firm's reputation, not necessarily a profit motive relating to the disposition of the lands themselves. And more generally, I have thought for a long time about greenfield development because in general, I am opposed to further greenfield development beyond our current boundary as is outlined in the city plan. But the fact is that Astor, Shaughnessy, Goodrich Corners will be developed. They're already slated for development, whether by us or by private industry. And I would rather see the city continuing to make a profit off of those lands like we have been for decades through ELD, and over time, potentially see that reinvestment into infill opportunities as outlined in our city plan. And I think the interesting position we're in as councillors is that we're forced to think and operate in these really long intergenerational timescales. And these three neighborhoods were approved decades ago. And as much as I want us to move away from suburban expansion, selling these assets is not going to do that. And as many of the speakers and industry members mentioned, one of the primary roles of the city is that of regulator. And through regulation, I think we have the ability to start to shift those development patterns to infill rather than greenfield, using tools like zoning bylaw renewal, district planning, and growth management to achieve our 50% infill targets, again, as outlined by the city plan. And divesting from greenfield development doesn't in and of itself limit greenfield development. Setting clear policy direction and implementing the city plan does. Simply liquidating these assets means that private industry will profit in the place of the city. And I don't feel that will serve current or future Edmontonians well. And I also really want to avoid getting caught in kind of a false dichotomy here. I think that investing in catalyst projects, infrastructure that supports infill or other city building priorities is not dependent on the sale of these lands. I do think that we need to have further conversation about reviewing and updating ELD's land development policy and dividend policy to provide greater clarity on this council's direction. And if it is the will of council, that direction could include the allocation of ELD's retained earnings to catalyst projects, as we have discussed throughout these many days that we've been talking about this. So I have enjoyed hearing about my colleagues' enthusiasm for those catalyst type projects, and I think that could be a very productive next step to take. So again, I will be supporting Councillor Jans's original motion, and thank you again for all of the dialogue and discussion.
Thank you, Councillor Salvador. Councillor Stevenson.
Thank you, Mr. Mayor, and thank you, Councillor Salvador, for those really eloquent and important words that you just shared. I won't repeat the items you covered because I think you covered them very well. What I do want to speak to is why I'm pleased to support this motion and the great opportunity that I see is it provides us to come up with a strategy in advance of a decision. I think what I've been seeing through this process is, a decision that we're going to make that will then drive our strategy. So from process perspective, I think that this this motion gives us the opportunity to think really strategically as a corporation about our land assets and how we use them. So I do differ a bit from my colleague in the sense that I do see a future. I do see a potential opportunity where the sale of Astor Goodrich makes sense, that's the right strategic approach to catalyzing other investment. But what I'm really looking forward to seeing as part 4 of this motion is a very detailed consideration about what our greatest infrastructure investment needs are for realizing city plan. So again, I've spoken of some catalyst projects and exhibition lands, Rossdale, but I also think there's a huge catalytic opportunity in terms of smaller scale and broader infrastructure upgrades that would enable missing middle and the development that we want to see around our LRT stations. So this ties into our growth management framework, and it is, I believe, absolutely critical that these conversations happen in parallel and in conversation with each other. The decisions that we make with our land assets and any revenues that we get from that, how we catalyze our infill projects, it's absolutely essential that we do that. I've said it before, but I also am really hoping that the strategy that comes back in Q4 thinks well beyond the box that we've operated in the past. I'd love to see consideration of tools that we haven't implemented yet in terms of a municipal land corporation, really thinking strategically about our approach to our entire real estate portfolio. Right now, it seems we have different streams in terms of enterprise land, some of the catalyst projects, but I'm looking for that comprehensive vision for all of those working together towards vision, our city plan vision. So thank you, Councillor Jans, for putting this on the floor, and I look forward to voting in favor. Thank you.
Thank you, Councillor Salvador. Councillor Rice.
Thank you, Mr. Chair. I know a few days ago, and Councillor Cadmel spoke to this motion. I fully agree what he said, and also I would like to add a few points on the top of that. And I think I am a strong believer that the city should focus on its core services and avoid competing with the private sector. And as a public service cooperation, from economic growth and also from policy stability, and also build that business-friendly environment, I'm not going to support this motion. We will give the opportunity with our core city services. I believe selling land for development, and then we should focus on the maximized profits and for the financial return. And so I think that is the point I heard over and over. And we talk about to our city to make profits, but I think it's impossible and for our city to make profits and to keep and develop this by ourselves and then balance between make profits and infill projects. And with that said, I'm not going to support this. I will continue to looking forward our city to keep our policy stability and then focus on our city's own core services. And then from economic recovering and growth perspective, and we provide that business-friendly environment to support our city's economy recovery. Thank you.
Thank you, Councillor Rice. Councillor Wright.
Thank you very much, and for everybody's comments on this. I am in support of this motion, and I do thank Councillor Jans for bringing it forward. It's not only, I guess, supports our city plan and overall, I think, strategic direction, but I think it's also supports our smaller builders and those individual Edmontonians that are seeking home ownership in our city, and it also helps to keep some of that investment in our local economy as well. I appreciate the way that Enterprise Land Development has also put in some controls and in keeping with sort of climate change policies, looking at solar panels on the homes being built in the area. And I've seen them pop up in Laurel Green in the ward, and I hope to continue seeing that as well into the future. Thank you.
Thank you, Councillor Wright. Councillor Principe.
Thank you, Mr. Mayor. I will not be supporting this motion for reasons that many of my colleagues have already previously mentioned, so I will not repeat what has already been said. I will say that I have spent many hours reading many reports and listening to many people, so I make my decision with a lot of input and consideration. And I've come to this decision, and I see it as the best decision, not only for the community I live in and represent, but also for the city as a whole. Thank you.
Thank you, Councillor Wright. Sorry, Councillor Principe. Councillor Knack.
Thanks, you, Mr. Mayor, and apologies to my colleagues. As I said, I was only going to speak to it at committee, but there's been a few additional pieces of information that have come out since then that I feel I wanted to speak to and why I can't support this. So we have a couple of reports coming up very soon. For example, I think about our transit reports coming next week. And if you go through that report, you're going to see that over the course of the next 10, 15 years, we're going to need about $1.4 billion to expand transit garages so that we can improve transit service. We have a bike plan that's going to be coming before us that's in the order of about $300 million over 2 budget cycles to allow us to provide mobility choice and to achieve numerous climate goals that we have. Specific to climate goals, we don't have a clear indication yet. We're going to get that in our upcoming budget about what we'll need to invest to achieve our 1.5 degree target. We've talked about recreation spaces and the desire to have no more mega rec centers, but we're still going to have recreation needs across the city, and those will likely be in the order of tens of millions. And to be clear, I don't think if we sold this land, any of those things would be funded by these specific dollars, but they are still part of the broader capital budget that we're about to be dealing with. And if we think about the upcoming capital budget, about where you might allocate some funds like this, if we were to proceed, we've already touched on those. The industrial development to help grow our tax base, the significant costs that we're going to need to put forward to entice missing middle development across our communities, and as already mentioned, the larger infill projects in Rossdale and exhibition lands. So I appreciate the points. I mean, I agree that normally I would agree this isn't an either or, but with everything I've just listed and many things that we haven't even started to discuss yet, we do not have enough money to accomplish all of the goals in our upcoming capital budget cycle. That will mean we will, so the only way to accomplish that is by severely cutting back on other areas that are maybe lower priority, or by finding ways to help increase some level of funding so that we can accomplish these goals. And so for me, it is a bit of an either or. While I normally don't like that notion, I don't really see how we can fund everything that was just that I just listed, let alone anything else. And what I'm encouraged by is everyone wants to deliver on the city plan. I haven't heard anyone here today say we don't want to deliver on that, and don't want to deliver on our climate goals, and don't want to deliver on these other pieces. I just truly don't know how we're going to fund it. And now that we, now that we have some of those dollars from these upcoming reports to go off of, that just, I am very concerned that our main end goal will not be able to be achieved. And frankly, even if we sell the land as originally intended and bring in a course of about $80+ million over 2 years, that won't cover everything I've just listed either, but it would allow us, in particularly on those 3 areas where we can ideally generate new tax growth in a substantive way, help make a dent in those significant investments that need to happen on more of an upfront basis. So that's why I've been so concerned about a change to this, because I mean, if there's another solution, I would love to hear it, and I just don't know where that is. I mean, outside of raising taxes, but that we can only do so much either as well, right? I think there's an appetite. There's not going to be an appetite for 7% tax increase. I'm guessing. And so when I look at the expenditure required, not over the next 10 years, but in particular, just even the next 4 for some of our most ambitious goals, I'd rather have this funding available to us to help us begin to tackle those in a more meaningful way than I think we'd be able to do without it. So I know you sort of heard me talk about that at committee for those of you that attended, but I wanted to throw some of those numbers out and really ask people to consider that. We will be required to invest hundreds upon hundreds of millions to accomplish our city plan goals over the next 4 years. We need to make sure we have funding in place to do that. Thank you.
Thank you, Councillor Knack. Councillor Rutherford.
Thank you, Mr. Mayor. I'm not going to talk too long because I want to just say that many have already echoed my sentiments and why I will be supporting this motion. But I did want to highlight a few things, that came up both from the committee discussion and then in hearing other people speak. And I think for me, the deciding factor is really about the overall public good. That is what we are here for as governors. And when it was presented at committee and we were told flat out, private sector doesn't do anything unless there's profitability, that is exactly why public sector is supposed to exist. And there's opportunities with these lands that look at things in a way that aren't just about profit. And so I do agree, and I'm really thankful for Councillor Stevenson for adding the 4th point to the motion, because I think it allows us the time to really have that thoughtful dialogue and look at this from a perspective of saying, yeah, from an economic perspective, maybe a little bit of upfront cash is nice, but as even Councillor Knack said in his own comments, 80 million is not really going to get us that far. And what could this land potentially do in other ways if we looked at this more creatively? We looked at this from the lens of public good. I do also really take to heart the messages that were delivered by the speakers at committee in terms of regulatory tools, and I agree. We as a council need to do more regulatory tools, so thank you. I'm glad they highlighted that to us, because I absolutely will be exploring that further, because you're right. If we want to hit our climate goals, if we want to hit some of those city plan goals, we have the biggest tool in our toolbox, which is regulation. And so I think we need to take that a step further as well. And, this philosophical discussion about whether we should or shouldn't be in the business of greenfield. Another thing that really solidified my decision today was the fact that administration could not give any examples that didn't have other municipalities also in the same business. So why are we pulling out of a business that other municipalities are still in, if this is a bigger philosophical question? And I didn't hear any convincing reasons to either stay or go, besides industry feeling like we shouldn't be in this business. So, I'm pretty passionate about this one. I've been really hard to come to this decision. I've flip-flopped quite a bit through these discussions. But at the end of the day, this is a value-based decision, and I'm here for the public good. And so in my perspective, and I respect my council colleagues and their perspective of the economic upfront cash flow is public good. But from the lens I'm looking at, I think holding it and being a little bit more slow in our understanding of why and what could be potential with this greenfield development is, for me, in the better interest of the public good. Thank you.
Thank you, Councillor Jans. Councillor Tang. Sorry, that was
Thank you,
Councillor
Mr.
Rutherford. What I'm talking about, I was totally lost my mind here. It was
Sorry?
Councillor Rutherford who spoke. I said Councillor Jans. I don't know why.
Well,
Oh my, sorry about Councillor Rutherford. My apologies. No, sorry, Councillor Tang, you go ahead.
okay, no worries. It's been a pretty intense day. Well, thank you, Mr. Mayor, and thank you to all my colleagues. Lots of great arguments put forward, not just today, but in the past few meetings on both sides. I will be supporting this motion, and in particular, the fourth item, and I'll talk a little bit about the things that I've heard. When this came up initially, I was on the side of, I don't think we should be reversing past council decisions, considering that we are a continuum of that. I was mostly concerned about the integrity of our decision-making process. And also, this idea that, city is not in the business of greenfield development. Many weeks have passed since that very first conversation, and I've been talking about this issue as well with many of residents in the ward, which has one of the prime example of city development in Millwoods. And I think the conversation has been really interesting. City isn't the perfect developer. They by no means am I saying that we're doing a great job. However, our motives are different when it comes to developing some of these land. And in particular, with some of the neighborhoods in the ward, the feedback that I've also gotten is that if it weren't for the city, I don't think we would have achieved some of our goals when it comes to affordability and providing some of those programs for residents. And I know those are not necessarily what we're talking about, or I know those are not necessarily on the table, but I don't think that's necessarily a fair statement to say that we're not in the business of greenfield development, because we're not in that. That is not our business. We're in other businesses as well. And I think like all of my colleagues here, I have spent hours on this topic for weeks and weeks, and talking to many people who have worked on this policy directly, people from administration, people from the development sector, and residents, of course. And so this isn't a light decision. And I do think that, over the last few weeks, I just don't think the argument, I guess, against this motion or to keep the past council decision is necessarily as strong or as convincing to me as I would have expected, actually. So for all those pieces, I will be supporting Councillor Jance's motion. And I appreciate, many of the arguments that my colleagues have brought forward in support of, that I am also in agreement with. Thank you, Mr. Mayor.
Thank you, Councillor Tang. I have already spoken to this motion in favor of it at the committee, so I don't need to speak again, and I will go to Councillor Jans to close.
Thank you, Mr. Mayor. And thank you to all of my colleagues, especially the returning councillors, for their patience through this debate. I have no doubt it's been incredibly frustrating to go through this, but I think for $120 million, I'm certainly willing to have a few more conversations. And because we're working through lunch, the analogy that comes to mind is we have this chicken, and we can either slaughter the chicken today and get some meat and have a great lunch, or rather we can keep the chicken and get $120 million in eggs over the next 25 years. And that to me is what this is all about. We all agree, industry agrees, the admin agrees, everyone agrees that there will be money made from these three sites. And the question is, who profits? And I can't help but echo and applaud the remarks of Councillor Salvador and others who have spoken in favor. I think they nailed it. So I will just say that the most illuminating part of this whole debate and hearing from industry is that we need a lobbyist registry. We need to understand how private interests interact, not just with councillors, not just with the mayor, but with administration. We need to work as we go forward with city plan to make sure that we are applying the same scrutiny to all of the lobbying, all of the emails, all of the invitation to leadership dinners and events and everything else that industry has exerted. We need to make sure that this is transparent and that this is accountable and that we help connect the dots. And I don't have a subsequent motion ready to this motion today, but I'd certainly want to flag for you that that's been clear. It's something that's been very emergent through this process, based on how I have experienced being lobbied as one councillor. So thank you very much, and ready to vote.
Thank you, Councillor Jans. Please vote.
We have all the votes, Mr. Mayor.
Display the votes, please. That has carried. Okay, now we go into, so 6.8 is dealt with. Go to 6.2, Madam
Yeah,
Clerk.
we're back to 6.2, Mr. Mayor.
Back to 6.2, which is efficiencies in municipal service delivery. This was selected by Councillor Rice, and this is a motion on the floor postponed from the November 30th, December 1st, 8th, 10th, 14th, 15th. This is the budget meeting, basically. Council budget meeting. Okay. All right. Is there any presentation on this, Madam Mr. City Manager?
I don't believe so.
Okay.
Do we?
So the motion is just
Sorry.
going to go right back on the floor, Mr. Mayor,
Okay.
From December.
Okay, can you please do that? Okay, so the motion is that administration return to City Council with options to reduce the expenditure budget by $10 million with the focus on efficiencies in municipal service delivery. Okay, any questions to this? And I'll just give a few seconds for people to start clicking in to speak or sir, questions. Or Councillor Paquette, you are first.
Yeah, thank you, Mr. Mayor. To administration, we did go through a cost-cutting exercise, I guess you could say, due to COVID and some economic downturn pressures. So I'm assuming this isn't going to be too much work for you because you may already have this information on hand.
No, I think it'll be a lot of work to do
Oh,
as I
okay.
read the motion, because we're going to have to do all the work we've done before again, I think, to make sure it's timely and validated. And a lot has changed, including the 25 or so budget amendments that were done in the fall. So I think it's going to be quite a lot of work to provide this. And I would worry that I think the focus should be on getting ready for the fall 4-year budget, and we will do a lot of this work to prepare for the fall 4-year budget. So I don't want to underestimate the amount of work this will require, because so much has changed since the last time we did it.
Okay, and the city already has an efficiency policy. How does this square with that?
I think it's in line with the efficiency policy, and I think we've implemented that efficiency policy. So I don't see this motion being conflicting with that in any way. But I would say that we've done a lot of this work. We continue to do this work.
Okay. For the benefit of new councillors who may not know about it, can you please tell them about what we already do?
Yeah, perhaps ask Ms. Padbury to comment on some of that, please.
Okay, thank you.
So I would say that as part of our regular budgetary processes, we're always looking for the most efficient means of doing business, including any reductions and any reallocations. So every time there's a pressure, we look for Are there ways that we can deliver things more efficiently in order to fund a new service line before we bring forward and ask to council? And I would also add, in the past, we've done a number of initiatives, whether that is through the 2% and innovation initiatives that were underpinned the 2015 to 18 budget, the initiatives where we brought forward options to reduce taxes by reduce the tax increase by 4%, 3%, 2%, 1%. We brought you back as zero in 2020. So these are all well ingrained into our budgetary processes.
And I'll just add one final example. As we prepared for the fall budget that this council deliberated on, we took $4 million out of administration. You could consider overhead for travel and all those other things. That was taken out of the budget as part of an adjustment before we came to council in the fall.
Okay, and that's one of the things that's occurring to me is that we just went through multiple years of effectively 0% tax increases, which in itself is much more than a $10,000 or $10 million efficiency effort. And this year, our tax rate was one of the lowest in Alberta, if not across the country, and does not even keep up with inflation. So we're talking about even more money, far more than $10 million being spent on being attributed to efficiency, I guess you would say, because we're not actually keeping up with our own bills, so to speak.
Yes.
So I'm just wondering if through those efforts we already do this.
So I do believe we do this. If we're asked to do this, I'm what you would likely see come back is some of the other ideas we've brought to council in the past that have been rejected by council, like contracting out bus cleaners, like some of the ideas that came up in the Reimagine report that were rejected by council last year, parking fees and things like that. So those are some of the things that would likely be the result of this work.
Yeah, so I really appreciate the spirit and intent of this motion. I think that the motivation is a great one. It's fantastic. But I'm just concerned that we're just adding on top of the stress and pressures we are already experiencing by now going into a realm where, frankly, we're going to be faced with really unappealing options that the public is unlikely to support. So I'll just leave it there. Thanks.
Thank you. So that was your speaking to this, right, Councillor Paquette? Good. Thank you. And part of questions as well. Go, okay, Councillor Rice.
Mr. Chair, before I speak, I would like to get clarification from you and Madam Clerk. And then do I need to introduce this motion first before I ask a question? And I thought that is the regular process before we ask a question.
So
and
my understanding, Councillor Rice, because this was already a motion on the floor and was introduced at the budget, right? Am I right on that?
Yeah, so this actually was made back during the fall
so,
budget deliberations. It's already been introduced.
Yeah, so that's why my understanding, Councillor Rice. But if you want to reintroduce it, I will absolutely go ahead. If you want to, yeah,
sure.
as part, yeah.
Yeah, I understand we had like different motion and wording and different focus back to the budget deliberation and then specifically. And actually right now, the motion on the floor, I would like to clarify the intention is not about the resources review. It's about the service delivery review. And then with that said, and then because, and then I believe like every councillor have been heard and from our public about how our business as a city government and to be delivered. And then we heard so many concerns and regarding the timeline and regarding the results and with the existing resources we provided to deliver. And so the question, and we come behind this motion is about And when every time the new business service line added, do we just only focus on to increase our resources, or we look at how our city can do things differently and to increase that efficiency and from public perspective? So this motion is not about the money, $10 million, or it's so little, doesn't worth us to do, but actually the taxpayer dollars, no matter how much. And then it's not about, oh, we already have done this review. I did research. I tried to find our city's delivery services efficiency review. I couldn't find it. If I missed something, I apologize. But I couldn't find this. I think it's worth for our time. And then specifically after 2.5 years, and for COVID-19, there are so many things changed. For city to look at how we deliver our services. And with the limited resources, we talk about the limited budget. We talk about how manpower resources. There's so many things. When we talk about the city's public service delivery efficiency, there are actually two factors we need to think about. One is the resources and how we set up resources and to support the actions we are taking to deliver public services. And then how we do it, how we take actions, actually that is reflect our city's delivery efficiency. I think this one, specifically this motion, I'm not ask you repeat your work you already done in the past. I just would like to look at in this from new city council perspective, and also look at the new situation and for so many change in the past 2 years in our world and in our country and in our city, excuse me. And then is there any way we can look at our municipal level and for our public service to be delivered and to see that efficiency piece to address how we achieved so many goals we would like to do. And then I think that is the expectation from our Edmontonians. I think that is what's the voice I heard over and over. And this is why this motion is brought up. And then I encourage our my colleague councillors to consider this motion and then to get the information and say, is there any way we could do things differently, more efficiency, and to address the concerns public have? Thank you.
Thank you, Councillor Rice. Councillor Jans, to question or speak?
I want to call the question, so if Councillor Tang can go first, I'll do that after her.
Okay, Councillor Tang, questions or speak?
Yeah, I just have a couple questions. I guess first to the mover. When you say efficiency in municipal service delivery, what does the efficient municipal service delivery look like to you?
I think it's not is how it looks like to me. How it looks like to the public. And when we talk about the efficiency specifically, do we have the measures in place right now? I would like to turn this question back to administration.
So
and how we measure. I think how it looks like should based on how we measure it.
So is that part of your goal then to include that sort of measurement system as part of this work, right?
Yes, that's right.
Okay. And then Mr. Kerbal, what is our current measurement system for efficiency in municipal service delivery?
Yeah, I might ask Stacey's team to comment, but before I do, I just want to be clear that the motion does require a budget reduction. And so we will have to, if this motion passes, come back with financial budget reduction options for council. But Ms. Padbury, do you want to talk about the efficiency piece, please?
I'll maybe ask Ms. Matheson to talk about what we're doing in terms of measuring efficiency.
Sure, thanks for that, Stacey. So right now we do have an enterprise performance management program with actually a report coming to council here in, I think, the end of Q1. So there will be more information coming about the program, but basically we've taken all of our services, this list of 73, and started to apply various corporate strategic service and operating level measures to those. So there's a variety of ways in which we measure our service, depending on what we need from an operational lens versus what is more of that community indicator type of lens. So that's one of the ways in which we look at that.
And then do you have a way to sort of, I guess, capture the public perception of efficiency?
We do. So historically, we've had the citizen satisfaction survey as well as the community perception survey. And both of those are currently under review for how we will continue to do that going forward. And there is a community perception indicator level in there about how they perceive city services to be, as well as we do ongoing regular smaller service reviews, service surveys about all of the various levels of satisfaction from garbage pickup to transit to community services.
Gotcha. So that information that you just outlined, along with the enterprise report that you were talking about, would essentially sort of address some of the pieces from this motion, would you say?
They do. They help inform where we should go in and do deeper level service reviews and process reviews as well. So as we review and analyze that feedback, we take a look at where do we want to focus some of our attention to make sure that we are doing that review to see if those services are as efficient and effective and relevant as they could be.
Okay, great. Thank you very much. I'm ready to speak to it, but I see Councillor Knack on the board. So
You can do it now if you want to do it in 2 minutes.
Yeah, I can just, I'll be really quick. I appreciate the intent of this. In fact, I think I had something quite similar with this very similar intent when I look back at our corporation's overhead. I can't remember between 2014 and recently, and this was something I was pondering during the budget deliberation. And I had a line of questioning actually at the time, just in terms of, can we do further trimming? And I do remember, and correct me if I'm wrong, Mr. Corbel, that at the time you said that this is actually like we're down to the bare skeleton. And of course, there's more we can do, but that is part of why Reimagine Town came forward and all of that, because we're really getting into the public-facing service delivery. I was more interested on the internal side, how much further can we cut? And so just, I guess echoing a lot of what Councillor Paquette has already brought up, just knowing the constant examination of what we can do better and where we can cut costs, and the effort that administration has gone to do this. And all the reports that are coming forward, I worry about the redundancy of this motion, and for all those reasons, I will not be supporting it. Thank you.
Thank you, Councillor Tang. Councillor Knack. Speak or questions?
The questions, please.
Go ahead.
So I wanted to, because I think originally when this motion was brought forward, it was meant to look for this during our current year's budget, but I should double check. Right now, there's nothing in the motion that talks about whether we should be focusing it on this year or as part of the 4-year budget deliberations. And so I guess I wanted to just confirm with the mover their original intent, because that's not expressly clear in the motion.
So the motion originally brought up is to 2022 budget. And right now, because that budget is already gone, and so that's why. So it's not clear. So the intention is if we could take this clear looking and for the next budget adjustment or for 2023-26, and because efficiency is so important for us when we set up a budget.
Absolutely. So that's helpful. So I heard that, maybe SOVA or the 2023. And so I want to ask maybe Mr. Corbel to start, because is there going to be a discussion? Are we thinking about having a council discussion around what our tolerance is for our upcoming budget deliberations? We've started some prioritized discussions. You're going through a prioritized based budget, but is that a conversation you've been planning on us having?
Yes, Councillor, it's one that we would like to have. We wanted to see how the discussion this week went, which was really helpful. I think that would be a very helpful next step, and we would be delighted if Council wants to have that discussion.
Okay, that's helpful to know because, so my initial thinking was to support the motion because over the years, as Councillor Paquette rightly identified, there have been motions that we've made to help advance this. But I get an impression that we will have a bit of that conversation based off what you've just shared with me, Mr. Corbould. So there will be a future council discussion, maybe on one of the Wednesday afternoon sessions, where we'll talk about what we're interested in, what we've been hearing from constituents, and share that information so that you can be informed to help present some options for us or have something to work towards.
Yeah, we would be delighted to do that. And Ms. Padbury and I have been talking about, very shortly, now that we've had the strategic discussion, laying out in a memo to council the concept of, what we would do over the course of the next 8 months leading up to the fall budget, so that we can confirm with council that meets the intent for conversations like you've just mentioned.
Okay. So then with that in mind, because I think a conversation like this is critically important, but now I'm hearing that we're likely going to have that. So I'm starting to wonder if we should be as prescriptive as this motion is currently worded, because maybe maybe council wants to do more than that. Maybe we want to do less, or maybe there's a range of opinions and we need to know that. So to the mover, I'm wondering now if there's a way, recognizing what we've just heard, which is that we're going to have a chance as a council to discuss sort of what our expectations are for budget, if either the motion is needed at all, or if we should simply remove reference to a specific dollar amount, because we're going to be having a conversation about that where we might want to look at more or less, anything like that. So I want to get your initial take on that, just based off what you've heard from Mr. Corbould.
I understand we have that strategic priorities or also operational priorities discussion and come in, and we already started. And however, I think the efficiency piece and then it's so important and in our public service delivery. And to answer your question for that budget dollar amount, we could move. But the key point I would like to say is about that fiscal efficiency piece.
Absolutely.
And that fiscal efficiency piece, and then what we heard over and over is about how we get maximum value and from the tax dollars we paid. And then how we can demonstrate the different level efficiency and into this motion and get some options and from administration and say when we deliver public service, how we reflect the fiscal efficiency, how we reflect service delivery efficiency. So if like somebody has some better friendly amendment.
I think my amendment would just be to remove the reference to the 10 million because we're going to have that conversation. So that would be an amendment I'd move to help make sure we can have this conversation.
Sure. Yeah, I can accept that. And then to broad like more strategic level discussion and then get more options. Yeah.
So that's my amendment, Mr. Mayor. I don't know if it's friendly or not, but just to make it clear.
For me, I can consider it's a friendly amendment.
So then the motion would read that administration return to City Council with options to reduce the expenditure budget with the focus on efficiencies in municipal service delivery?
Correct.
That's not really is that a direction?
I believe so, because I've heard we're likely going to have conversations like this. So you could argue maybe then the motion is a bit redundant, but it makes it explicit too. So I'm okay with making that explicit.
I'll take that motion as an exercise to go back and find further cost savings for the city that are included with efficiencies. But it clearly tells me to reduce our budgets. So.
Yeah. Okay.
The other thing I would offer, Your Worship, is that one other opportunity is when we bring the capital and operating investment outlooks. The efficiency part is a part of that discussion, which will happen in the spring.
Yeah. Okay. All right.
So, Mr. Mayor, can you just give me direction? Is that a friendly amendment to the whole of the assembly or not?
Okay, we gotta get a sense from the assembly if this is a friendly amendment, even though it still pushes for expenditure reductions. I just want to get a sense.
It's not friendly.
Okay, so that is not friendly then. That you need unanimous consent, right?
Yes, so can I get clarification if Councillor Knack would like to make that as an official amendment, please, to the motion on the floor?
Yes.
Councillor Knack is making a amendment to the motion, which is to take out $10 million. So we have an amendment on the floor. All right. Any
Technically need a
questions?
seconder before I can.
Yeah, of course. Anyone second?
Second.
Seconded by Councillor Hamilton. Okay. Any questions to the amendment? I'll just wait for the deck to be cleared from this.
Yeah, we're just loading the amendment into the system.
Okay. All right. Now, Councillor, this is still the old list, but I'll follow that and I'll go through the list of Councillor Jans to amendment. Councillor Jans is to speak to amendment.
It renders the whole thing meaningless. I oppose.
Okay. Councillor Rice to the amendment.
I agree.
Okay.
Support.
Councillor Rutherford to questions on amendments or speak to the amendment.
Question
Go
to
ahead.
the amendment to the mover.
Go ahead.
Are you worried at all about the morale implications of this amendment and creating ambiguity to administration when we already know morale is low?
I'm not, because I hope what I heard from the city manager is we're going to be having a discussion about this. So in a way, one could argue the motion's a touch redundant, but better to be explicit that we do still want to examine all things as part of our budget. So I think that was an expectation either way.
But even with the amendment removing of this specific dollar amount, the city manager has been clear that the direction is to reduce the budget rather than a holistic discussion on how do we find those efficiencies and where are our priorities and where do we want to spend money and where do we want to stop maybe spending money. But I feel like those are very different toned conversations. How do you feel about that?
Yeah, fair. I would expect that this wouldn't preclude any of that. My understanding is that there was a desire to make sure that was part of the conversation, but I wouldn't want that to be the only part of the conversation. What you've highlighted is by far and away the better approach. So if that's understood, then I'm fine with voting down everything. But just wanted to make sure that we had a chance to make it clear that that would be discussed.
Yeah, I think it still stands. I wasn't supportive of the motion on the floor in December. I was worried about the impact on staff morale. I'm still not supportive. Even this amendment to me actually makes it worse because it creates more uncertainty in an already uncertain time. So I will not be supporting the amendment or the original motion on the floor. Thank you.
Okay. All right. Thank you, Councillor Rutherford. I was a little bit distracted. We are trying to figure out how to eat while we convene the meeting. Thank you. Okay, Councillor Stevenson.
Yeah, Councillor Rutherford really covered off my points. I think the wording that troubles me in the motion is the reduction. Happy to focus on efficiencies, but I think, as I've understood, administration does need direction for that. So I will not be supporting the amendment or the original motion as it stands, while recognizing that working towards efficiency is something that I'm always keen for and look forward to seeing reflected in our priority-based budgeting conversations. Thank you.
Thank you, Councillor Stevenson. Councillor Paquette.
Thank you, Mr. Mayor. I appreciate the intent of removing the $10 million because it's a little bit arbitrary, but I won't support the amendment simply because I'm not going to support the motion. And so to me, it's immaterial. I support the spirit of the motion and the drive behind the motion, but I think that we're already having these discussions, and we will always have these discussions. So sort of an arbitrary ask to become more efficient, while in spirit is great, and we already have it in policy. So that's why I won't support this amendment, because I feel like we've got just a little bit too many redundancies in the mix here. Thank you, Mr. Mayor.
Thank you, Councillor Paquette. Councillor Salvador, can you take the chair, please?
Yes, I have the chair.
Thank you. I do appreciate the intent of Councillor Rice and Councillor Knack, but I think the conversation that we need to have is how we implement the ambitious plan that we have in place to tackle climate change, to meet our goals under city plan, and how we implement the work that we are undertaking on anti-racism work, and the work we needed to do on reconciliation, and the work we need to do to bring more life back into our downtown, our business districts, and the economic growth that we need to spur in our city, right? And all of that discussion will require us to reallocate resources within the resources that are available to us now, and prioritize those resources to target those outcomes. So I think whenever we talk about reductions in the budget, whenever we try to reduce the base amount of money that we have in the budget, it hinders our ability to actually do the work that we need to do, because that reduces our ability to actually reallocate those resources to those priorities, right? So that's why I'm looking forward to the conversation that we will have with our administration on efficiencies not to reduce expenditures, but efficiencies to reallocate those resources to new priorities of council. So that's one reason. The second is I really hear and feel that what Councillor Rutherford has said on morale of our workforce. I think we heard today that I think 80% of our workforce is front-facing, and they've been working in the front lines. They have not been working from home. I'm not saying that working from home is easy, but they've been out there in the field in the middle of the pandemic, delivering those necessary quality public services that our citizens and Edmontonians rely on. And we need to give them certainty. We need to give them predictability. And we need to make sure that they know that we have their back. And that we value the work they do. It's not that this motion doesn't say that we don't value the work we do, but I think it does create uncertainty whenever we talk about expenditure reductions, because large percentage of our city budget is actually employees and the wages and the benefits. So that's the second reason. The third, as we just went through a budget exercise where we passed a very reasonable tax increase, which was the lowest in the capital region, which was lowest compared to all major urban centers in Canada. So we have done some of their work, and our administration has done some of their work in the previous years by keeping taxes low. I think going further into reductions without actually looking at a reduction in programs and services at this time, I don't think it's possible. And even if it's possible to reduce expenditures, then we should be looking at actually reallocating those resources to our new priorities. So that's why I appreciate the intent, absolutely understand that, but I don't think I'll be able to support this motion. And I will take the chair back.
Yep, chair is yours.
Okay, and I'll go to Councillor Principe.
Thank you, Mr. Mayor. I just wanted to say I will be supporting this motion because the way I read it, it says a focus on efficiencies in municipal service deliveries, not solely on municipal service delivery. And I do think that there are other areas where we can be more efficient within the city. And I do look forward to further discussions on that. I was voted in, and in my platform, I did state that I was going to be looking and putting my input and a new perspective on how we can be more efficient in the city. So that's why I will be supporting this motion. Thank you.
Thank you, Councillor Principe. And Councillor Jens is to speak on this. Councillor Rice, you have already spoken. You don't have any questions on that. Councillor Knack to close.
Sure. Thank you, Mr. Mayor. Yeah, this is one of those awkward opportunities where I got a sense early on, frankly, that the original motion might not pass based off some of the dialogue. And at the same time, I've understood through the answers to the questions that it's work we're probably going to be doing as a council as a part of a broader body of work, which was identified a bit earlier by Councillor Rutherford. And so sometimes I worry when a motion like this fails, which the work is planning on happening, if it sends a message to administration that we shouldn't do that at all. So to make it very clear, I'm guessing the amendment's going to fail. That's fine. I'm guessing the main motion is going to fail, which is fine. But I just want to be clear that I still want to talk about cost efficiencies, how we're going to do that work as part of the overall budget exercise. So I would highly note to administration that a failed motion here should not mean that we're not going to have that conversation. But I gather from my colleagues that they just want to make sure it's holistic. That was my intent as well. I will just offer one piece, and part of why I think sometimes it's good to have motions like this. Councillor Paquette, when he was asking questions, mentioned, and then we had a response about the 4%, 3%, 2%, 1% report. That was actually as part of the 2019 to 2022 budget cycle. And that was a motion council put forward a few months before we went into deliberations. And through that, we actually were able to find an additional $65 million in efficiencies over that 4-year budget cycle, which was essentially either reallocated or used to help bring down the tax burden. That wouldn't have happened if council hadn't been clear in making that motion. That body of work was new over and above. So I do think we need to have conversations like this, and sometimes it's good to put targets out there, even if you don't go through it. The 4% motion would have been a couple $100 million in savings, and council saw the list and said, we're not going to do all of that because clearly some of those cuts would have been too much. So that's just why I think it is good for us to occasionally document this and make sure folks know that these can actually produce savings. So again, I get it's going to fail. I've heard enough at this point, but I hope that when we have that broader conversation in the next couple of months here as a council, that we do think about what realistic options we want to consider. Doesn't mean we need to remove by 10 million or remove by 5 million or remove by 20 or increase by 50. But we should know clearly what that's going to look like, and doing the prioritized based budget should get us there either way. I didn't feel it would have hurt to have this motion, but just wanted to share that as some insights. So go ahead and not support it. I get it at this point, but just wanted to offer some of that additional insight. Thank you, Mr. Mayor.
Thank you, Councillor Knack. Okay, to vote. Please vote.
Point of order, Mr. Chair.
Yes, Councillor Rice?
I did do opening introduction for this motion, and as a mover for this motion, do I need to do closing?
No, so we are not voting on your motion yet, Councillor Rice. We are voting we're voting on the amendment.
Amendment.
On the
thank
amendment.
you.
Yeah.
So
Please vote.
Thank you.
Vote on the amendment.
Thank you.
Oh, sorry, I got a revote.
Sorry, I voted wrong.
Me too. Both of us
So
voted wrong.
we're gonna call the vote back,
Yeah.
and we're gonna resend it out.
Please, yeah.
We're just waiting for one more. We have all the votes.
Display the votes, please. That is defeated. Okay, and now we go to the original motion from Councillor Rice, and I'll just wait for the list of speakers to be. Okay, Councillor Jans to speak to this, then Councillor Rice will close on this.
Mr. Mayor, I would like to call the question.
There are no more questions on this, so.
Yes, that triggers a vote immediately, does it not?
Yeah, so we are going to go to vote because you're the only one on the deck, and then Councillor Rice to close on this.
No, there's no closing. If there's a call to question and it's with unanimous consent, you go straight to vote, Mr. Mayor.
Yeah, we were going to go anyways, right, after Councillor Rice would have closed it on this item. So I don't know why do you want to deny Councillor Rice the ability to close on this item?
Because I wanted to call the question before even the amendment, but we didn't have the chance to do that. I don't know why when I indicated earlier, well, okay, never mind. I withdraw my call to question, and yeah, we'll follow up after.
Yeah, and you.
Point of order, a calling of the question requires a seconder.
Yeah.
Yeah, I just withdrew it.
Okay. Yeah, so you want to speak to this, Councillor Jans?
No, I'm good.
Okay, Councillor Rice to close, please.
Okay. First of all, I want to thank you, my colleagues, for your comments, for your consideration, and also for your questions. I think this is a great opportunity for us to look at how we can do our 23-26 budget cycle and more efficiently. And based on the past 3 months experience and as a new councillor, I do realize, yes, we put a lot of effort on planning how to spend our money and to support Edmontonians. Nothing wrong with that. I think the principle is everybody and in this chamber, we want to support our Edmontonians. And the question is about how. In the past 20 or 30 years and 10 years, and then I believe everybody heard over and over and how our public service could be delivered more efficiently and more fiscal and financially responsible. And then many people told me, we don't mind to pay taxes, but we do want to get the services back to match the tax value we paid. And yes, and this budget deliberation, we get the lowest property tax rate. But if we look back for the process, we can say right away how that could be difficult to get to the point for the 1.9% for the property tax. And then with that process, and then I was concerned, is anybody even asked when we planning to so much spending, do we ask where's the money from? Recently we approved $472 million to increase our city's borrowing authority. And did we ask the question, what's the plan for us to pay back? And we are carrying all these burdens, financial burdens, debt, and to the generation by generation. I think we need to stop doing that. And we do something in the past. It does not mean we should continue to do this and in the future. It's time to make some change. I would like to say this motion is nothing to do with our moral and in workforce. It's about review the process and review the delivery and approach. Is there anything we could find and to make some change to improve the delivery efficiency? And by that way, we can save some money and to support our vulnerable population, and we need support too. And then also this motion is not to reduce budget, Ms. Mayor. I would like to clarify that. This motion is to reduce expenditures. If you look at the adjustments we just passed, and for 2022 budget, we increased $41 million expenditures compared to 2021. 2021, our city spent $3.031 billion, and then we are planning in 22 and approved by City Council, and even I didn't agree. Increase $41 million spending on expenditure budget is not budget. So I would like to clarify that. And also what I heard over and over is not about we need to cut the budget. It's about how we can spend our financial resources more efficiently.
And I can call a point of order, Chair?
That fiscal efficiency piece and then needs to be emphasized in every dollar we are spending. And then I cannot repeat one more time the fiscal efficiency and service delivery efficiency and also process efficiency, and then how that can change our city's message sent to the public. How want our city moving forward for that? And with that, I encourage my colleague councillors to consider to support this motion. And even though you don't support removed by 10,000, but it's worth this time and to discuss the options for us to fund the saving in 2023 and 26 instead of keep planning more spending. Thank you.
Madam Clerk, Councillor Rice made a statement that says that her motion is not to reduce budget and expenditures. And when the intent is actually very clear in the motion that it is to reduce expenditures. So I just want to make sure that it is clear to us what we are voting on. Can administration please clarify that to us? Are we voting on a reduction in the budget?
Well, as I read the motion, Your Worship, it says with options to reduce the expenditure budget by 10 million with a focus on efficiencies in municipal service delivery. Yeah. So if that motion were to pass, I would look at efficiencies for sure, but I would find ways of reducing the budget by 10 million. Yeah. And coming back to council with options for that.
Okay. I just want to make sure that it's clear. Okay, please vote.
Can I give the additional clarification for my statement?
You have already closed on this, Councillor Rice. I just needed to clarify from administration as a chair what we were voting on.
But I don't want the misunderstanding, intake my information, my statement. I'm talking about the budget is not expenditure. So my intention is to reduce expenditure, is not reduce budget. That's two different things.
It is the same. It is reduce. Budget means we already passed a budget. We will be reducing that budget by $10 million. That's how I read it, and that's how city manager reads it. Yeah. So
it's not my intention. Sorry.
Yeah.
My intention is to reduce the expenditure. Is not reduce the budget.
Yeah. Okay. We're going to vote on it. Please vote.
We have all the votes.
Display the votes, please. That is defeated.
Mr. Mayor, I was going to put forward a subsequent, but I don't think it's necessary. May I ask administration a quick question as a part of process?
You can, and we have one more important item to deal with. So please be precise because we want to deal with police commissions.
Seconds. I'm just wondering, Councillor Rice said she was looking for evidence of the city finding efficiencies. I know we have reports on that. Is it possible to get those for council to see in advance of the budget deliberations?
Yes.
Okay, perfect. Thank you.
Good. And they can be provided through a memo to council. Okay, good. Thank you. Thank you, Councillor Paquette. All right. So
Just before we go into private to deal with our last item, is there any way that we could deal with our public motion, which is to get a motion without customary notice to
Yes.
change orders of the day?
Yeah.
For the February 22nd and 24th meeting is going to actually continue beyond 12 o'clock, and it's going to go till 5 o'clock, please.
Both days, right?
So
both days.
moved.
That's moved by Councillor Stevenson to,
So first of all, before we move the motion, we need to get permission to make a motion without customary notice. That would be the first step, if you
so
wouldn't mind.
Councillor Stevenson moved that we,
Make a motion without customary notice.
Second.
and we giving permission to who?
So Councillor Stevenson, seconded by Councillor Paquette.
But we need to identify the council member who will make a subsequent motion, right?
Sure.
Yeah, I think Councillor Cartmel, you there? I know you brought it up. right?
Yes, I am.
Okay, yeah. So will you make that, can I attach your name to make the subsequent motion?
Can, yes, Mayor Soki.
Thank you, Councillor Cartmel. All right, please vote.
We have all the votes, Mr. Mayor.
Thank you. Over to you, Councillor Cartmel.
So can we
Thank you, Mayor
just-
Soki. I will move that the orders of the day for the February 22nd, 24th council meeting be changed such that the meeting will begin at 9:30 a.m. and adjourn at 5 p.m. on both days.
Good. Seconded by
Second.
Councillor Salvador. All right, please vote.
Councillor Jans?
Support.
Thank you. We have all the votes, Mr. Mayor.
Thank you. Please display the votes. That is carried. And thank you, Councillor Cartmel. All right, we have one item left, right? In private?
We do, yeah, we do. We just have an item at a 9.3. I would just respectfully ask if you can give us 5 minutes, because some people have been,
Yes, so we
Just
can
5
move a
yeah.
motion to go into private, then the recess for 5 minutes? Okay. Can someone move that we
So-
go into private?
So moved.
Councillor Hamilton, second by
Second.
Councillor Tang to go into private. Please vote.
Councillor Jans? Thanks. We have all the votes.
Display the votes, please. That is carried, and we will recess for 5 minutes. I'll be
Yeah,
back.
and we'll need to get our colleagues on the it in about 3. Oh, look, we're already back online. We're good to
There
go.
you go,
There
see?
you go.
All right, on. Okay, I can go to Councillor Rutherford now. Councillor Rutherford.
Yes, Mayor Sohi, I have a motion I'd like to move, please.
Please go ahead.
So I move that administration return to the March 2022 City Council meeting with amendment to the Edmonton Police Commission bylaw to increase the number of City of Edmonton appointments by 1 to a maximum of 4. And the second part of that motion is that the actions outlined in attachment 3, what attachment number?
Because it's recruitment, I think it's like 37, so I'll figure that part out.
Okay, in attachment X be approved.
And then just if we could also have that the report remain in private, subject to FOIP. Apologies for missing that.
Yeah, and that this report remain in private, subject to the Freedom of Information and Protection. Sections, do you need me to say the sections?
It'll be 16 and 24 for sure, and a little bit of 29.
Applicable,
Yeah, okay.
applicable
Perfect.
sections, yeah, okay. And that is seconded by?
Second.
Seconded by Councillor Wright.
And so just to open this, I think, as we've learned and through this discussion on police safety, we've learned how important, the appointments are. And so if we have the ability to have an additional appointee for the police commission, I think it's prudent to do that. And I look forward to any questions that council colleagues may have on this motion.
Thank you, Councillor Rutherford, for introducing that motion. Any questions on the motion? I see none, and we can vote on it.
Yes, Madam Clerk.
Thanks, Councillor Hamilton. Sorry, we have all the votes, Mr. Mayor.
Display the votes, please. That is carried. And that concludes all the items, right?
Well, could we there could be some surprise notices of motion. We should probably.
Oh, I'll come to that. I'll come to that. I'm just saying, rest of the items that were on the agenda are dealt with. But before I go to notes of motions and motions with our customary notes, I really want to thank our administration for working through the lunch hours. And I really want to thank council colleagues for really being flexible and working through the lunch hour, because it was important for us to get through the agenda, and we are, we got through the agenda. So really, really appreciate for all the cooperation from everyone. And so with that, any notice of motions or motions without customary notice? Without customary notice, we already passed that one earlier on, right? Yeah. And so we are adjourned.